Global Namaste. Good morning, good afternoon, and good evening to all of you, wherever you are connecting from around the world. This is Vaishali Acharya, warmly welcoming you from London. Let us begin by invoking the divine energy within and around us as we recite the universal Gayatri Mantra, a prayer that illuminates our minds and guides us toward the light of wisdom and peace. Om Bhurbhuva Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Om Bhurbhuva Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Om Bhurbhuva Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Today, we explore a deeply important topic, integrated health, integrated care, also known as coordinated care, comprehensive care, seamless care, interprofessional care, or transmural care, is a growing movement in healthcare reform. It represents a shift toward a more holistic, connected, and patient-centered approach. Integrated care brings together professionals who collaborate to understand the unique needs of each individual and their caregivers, empowering them and delivering services in a way that ensures the best possible outcomes. This model of care doesn't just treat illness, it nurtures well-being by aligning medical, emotional, and social support. Now it is my great honor to introduce Professor Ish Sharma, my esteemed senior colleague, co-host, and producer at Healing Our Earth. Professor Sharma is a prominent Ayurvedic physician and the chair of Ayurvedic medicine at the University of Mauritius. His profound knowledge and dedication to holistic health are truly inspiring, and we are fortunate to have him with us today. And also Dr. Rajiv Gupta. I don't know how to introduce these legends because they have whole accolades and all the amazing degrees, all the amazing knowledge and experience they are having. Dr. Rajiv Gupta is MBBS, MRCP UK, DCH Glasgow, MD FRCPCH, MBA Triple Accredited UK, OUBS, and personal development qualifications as well. So without further ado, let's welcome Professor Ish Sharma first. Professor Sharma, global namaste to you, and Professor Rajiv, global namaste to all of you. Welcome. Over to you.
Thank you very much, Ms. Vaishali. It's always a pleasure to be on this platform and learn a lot, discuss a lot, and cannot say that to tell a lot because we don't have much to tell. So today we are here with a very special motive. What can be the real takeaway from these seminars for a layman, especially those who are not on this video conference with us, but those who are over the YouTube, Twitter, Facebook, etc. When they are listening to us, what one message they can carry home? That is what I discussed beforehand with the Dr. Rajiv Gupta, and I believe we have got something really valuable for a layman to follow. Dr. Rajiv, can we initiate the discussion, please?
Thank you so much, and I'm so delighted that this global platform healing our earth is truly healing. And being a medical practitioner, doing the allopathy, but also over past 10, 15 years, I have taken interest into other therapies, Ayurveda, yoga, Tai Chi, Qigong, acupuncture, homeopathy, etc. Because these are all toolbox. So it's really good we bring it truly integrated. And integrated mean connecting together. And if you think that truly speaking, from your point of view, Ish, Professor Ish Sharma is actually a legend. Had been working with the Ministry of Ayush. He has started so much program across the countries, particularly in Mauritius, introducing the diet program, particularly for children. However, as we discussed early this morning, I think it'll be good to see what practical help we can bring, putting together the, the modern medicine and Ayurveda as a focus in next 1 hour or so. So I believe you know that for now and next 15, 20, 30 years, modern medicine is still in mind of people as the first line. But I believe that in chronic conditions, Ayurveda has got a lot to help. Um, and in one way, when I learned, I did my certification outside my modern medicine long ago, 20, 30 years ago. I read the Swasthasya Swastha Rakshanam, and that is something which is so important, preservation of health and of healthy person, as well as treating the ailments in breaking causative factors for pathogenesis, which is so different in Ayurveda than modern medicine, because at times you are trying to control the disease like asthma, diabetes. You give the inhalers for asthma to suppress asthma or to relieve the symptoms. Same is for diabetes. You can give the treatment which is going to control the blood sugar. Same is for cholesterol. But taking that, knowing you have actually done a lot of work with the respiratory diseases and particularly asthma, and you have brought together and even cured some of the patients, which is not very common and is not recommended. So, do you want to just highlight, because in asthma, typical problem is that the lung tubes become narrower and therefore there is difficulty in breathing. And we, in our allopathic medicine, give these asthma inhaler, typically salbutamol, and that release the contraction or spasm to allow the airflow a little bit easier. And then we can give some preventive medicines so that these narrowing become less and less, and therefore there is more stabilization. However, the approach is very different in Ayurveda, and I know that yoga and different type of pranayams are fantastic in terms of improving the symptoms, improving the lung capacity, breathing capacity, and oxygen exchange. But there are also other methods and herbal medicines, etc., which all complement each other. So you have done fantastic work. It will be good to hear from you. How did it work? I believe something around 20 patients are completely cured and they're not taking any allopathic medicine, no panchakarma, no herbal medicines, and no modern medicines or asthma inhaler pump or anything. They're absolutely symptom free. So tell us what happened and what did you do, because that way our audience will benefit from it.
Thank you very much, Dr. Rajiv. And on the onset, I would like to thank Mr. Neil for this initiative, because the integrative health, this is very, very pertinent, very important, and unfortunately, very few people are doing this in the world. Because someone like you, who's a very expert in his own domain, you are from the hardcore Western medicine. Someone on this platform comes from Tai Chi, Ayurveda, yoga, mantra meditation, as you are going to bring one expert today. Now, unfortunately, the diseases have grown up so big that sometimes it could be very difficult to tackle them with one specialty. That is where we have to join hands. Whatever good can be delivered by the Western medicine, howsoever Ayurveda can support, even yoga, Tai Chi, meditation, meditation, and so on. Because the burden is so huge that one specialty might not serve it in its like a full to the satisfaction, to the total relief, to the best quality of life for the patient. That is where we have to join hands. When it comes to bronchial asthma, for the layman, I would be telling there are two types of diseases. One where we cannot breathe in, the restrictive breathing disorders, like we have a foreign body in our larynx and we cannot breathe in. Bronchial asthma is obstructive breathing disorder, like chronic obstructive pulmonary diseases, where the struggle is with breathing out. We do not breathe out efficiently. How do we diagnose? Normally, we breathe in for a longer time and we breathe out for a shorter time, because the breathing out is by the recoil of the alveoli. So the breathing out will be shorter and the breathing in time will be longer. In bronchial asthma patient, the breathing out time, expiration will be at least equal or longer than your inspiration time. That is the first diagnosis. Ayurveda believes, because many might not be knowing about Vata Pitta Kapha, Ayurveda says bronchial asthma is a Vata Kapha disorder originating from the Pitta place, the Pitta organ, that is the stomach. And how do we do it? How do we treat? To preserve the healthcare or to treat a patient, maybe with bronchial asthma or with any other disease, we always have got four principles, four approaches. Diet is the strongest medicine, as told by Kashyap, the first pediatrician of the world. His disciple questioned, "Oh, master, which is the strongest medicine in the world?" And Kashyap says, "Food." So we never start without making some dietetic corrections to any patient with having a 2 hours old headache or having a 20 hours old like a long-standing disease, maybe paralysis or cancer or whatnot, including bronchial asthma. Food, lifestyle modification, some herbs, and panchkarma. When it comes to bronchial asthma, if I can summarize, to a bronchial asthma patient, I will be stopping with two things. First, not to overeat. Second, not to take milk, not to take animal milk. When it comes to the second component, that is lifestyle modification, it will be exercising as much as possible of yoga practices, especially Kapalabhati, Kapalabhati pranayama. That is very much capacity building for your lungs. When it comes to herbs, then the best two herbs are out of the 1,000 herbs we study. The two best herbs are tulsi, holy basil, what we know as osmum sanctum, and ginger. Fresh ginger is food and dry ginger is medicine. Dry ginger will be 6 times more powerful than fresh ginger. So you should never avoid dry ginger. That is the medicine, tulsi, with some honey. So food, lifestyle modification, some herbs, and lastly comes the panchakarma. In the panchakarma, Vaman and Virachan. It will be a one-time Vaman and it will be a repeated Virachan. What is Vaman? Vaman is a kind of a therapeutic MSS. We induce vomitings for the patient. This might sound very awkward for the first timers, but this is such a powerful curative therapy. We induce a therapeutic, planned, and properly like protocoled Vamana vomiting procedure, followed by inducing some laxative treatments. Now, we could believe we are vomiting from our stomach. We are under the laxation effect at our large intestine. The problem is with the lungs. So, what are you doing with the lungs? Actually, the human body is much wiser than our short-sightedness, than our tunnel vision. This is one unit. And Vata, Pitta, Kapha, they come from the digestive tract. So cleansing your digestive tract with vomiting, followed by purgation therapy, what we know as the first two panchkarmas, Vaman and Virachan, we could cure, not only treat, not only suppress, but in the last like 30 years, 20 patients have been cured of their bronchial asthma. Now they are not on Ayurveda medicine. They are not buying medicines from me per se because they are giving me some business, or they are not on salbutamol bronchodilators or darifilin or steroids or on repeated panchkarma, they are simply cured. So this is one goodness out of countless goodnesses from Ayurveda, what we want to give back to the world. So this really will be very imperative and very worthwhile if we can treat one more patient, and I could claim not 20, it's 21 now, Dr. Rajiv.
21 is a very auspicious number, and therefore, I think, as we talked earlier, we will try and work it around and explain the whole theory, because currently the world is moving towards evidence based. So we will put everything in together. Say, for example, all like Vaman, Virech, and Nasya, and Basti, and whatever, what is the scientific basis, why it works and how it works, as you explained a little bit more, and Tulsi or Osimum Sanctum, as you explained. Also,
Very,
as I
very well
studied,
said. I'm interrupting, but I just cannot control this. First of all, Professor Sharma, what an amazing explanation. And Dr. Raju, I'm getting back to you soon, quickly. But I just cannot, because the way that you, number one, you said that exercise and alboli, it's like how much is it doesn't matter how much is the capacity of an alboli in terms of storing the VO2 max in terminology. When I was doing my ESI ACSM certification, I was taught like VO2 max, and when it was like when we were on treadmill or high intensity. So it's so important, the number one point you said that to all of our audience. And secondly, you said that something that you put a light on dry ginger. I would like to say something on that can you see these laddus?
ginger
I cannot
laddus.
taste them.
So these laddus are made of turmeric, dry ginger, uh, I can say jaggery, organic jaggery, and desi ghee. All right, so these are laddus. I have been eating these laddus since like ages, ever since I was a child. My mom that recently visited here in London, my mom made the whole stock of these laddus for me. So she always used to say that salt has all the immunity, but if the salt is combined with the ghee, and then only it makes something. So can you put, number one, my personal question is, what is the right time to eat this combination? Secondly, that is there any kind of like, is it good for everybody, or if someone is having, let's say, more acidic prakruti, or depending on the prakrutis we have, kapha, pitta, vata. So can you please put a light on that? Maybe I'm sure our audience, many people like me who would want to know that what is the right time to eat, and who is the best person who can have it. Over to you, both of you, whoever is.
Yeah, thank you, Vaishali. I will be very happy to be the one who can eat your laddus, so you can pass them on to me. I'll be very happy.
Sure.
Now,
Your
one,
skin will become so glowing as just like Vaishali, with all nice ghee and ginger.
so one size will not fit all. Like telling you can eat two laddus a day, which weigh like 50 grams, one size will not fit all. One composition will not fit all. When to eat, when not to eat, it is more important not to eat. So you should always be saying no to eating. Overeating is killing more and more people than starvation is killing. Unfortunately, we all are dying of overeating, albeit slowly, and I'm in no hurry. So we should really be saying no to eating, because calorie overload is the main mechanism to give us a lot of free radicals. Why do we age? Why do we die? Why do we fall ill? The most standard mechanism is free radical damage, and free radicals are coming from the excessive calorie we are putting into our mouth. So you should only be eating when you are really hungry. If this one principle out of like 20-30 years of my practice, and Dr. Rajan and Baljot will agree to me, if one principle we all can follow, if the world can follow, if we all start under eating, then we will not require these many hospitals 20 years from now. And not even as an exception, Ayurveda has told recommended to overeat. You could be falling down, you could be underweight, low blood pressure, low sugar, but overeating is never told even by mistake. So please, because as we know about the 2016 Nobel Prize autophagy by Professor Osumi, if we undereat, if we fast, then our body will be destroying our toxins, and the vata kapha accumulation in our bronchial tree, what leads to triggering bronchial asthma, that that congregation would be melted away. If the fire goes up, if pitta goes up, vata and kapha will be defeated, and your breathing channels will be much more freer, and you will be getting rid of this disease. So, and also when we induce vomiting, it has been proven by the scientists, it has been chemically proven that the vomitus is noted to be having so many histamines. And what is a histamine? Histamine is an allergen which causes bronchial spasm. So in the vomitus, the material which was thrown up, histamine was noted in abnormal quantities. It means histamine from your body goes out and your allergies go away. Dr. Rajiv will correct me, please.
Yeah, absolutely. Because this is one of the important, and for many, many years, almost for last 40, 60 years, this was the theory that it is pure allergen or histamine produces bronchospasm or narrowing of the lung tubes. Although lately there is also a theory that there is inflammation of the lung tubes or bronchial tree, and that is causing a further narrowing of this, and that is the reason the Ocimum sanctum or Tulsi, which has got eugenol or ursolic acid, and they have very strong anti-inflammatory property as well as bronchodilatory properties. And this is therefore fantastic that with simple natural things, we can relieve the symptoms, improve the longevity of the improvement or health, and perhaps some cases can cure the disease. So I think that is fantastic. And the other thing also, as Vaishali mentioned, is haritra or curcumin also has got very strong anti-inflammatory and antioxidant properties, and it modulates this cytokine activity, which is responsible for triggers of asthma. As the majority of us might know, the asthma get triggered by something. It could be some allergen, could be cat, animal dander, pollens, or anything like that. And if we have stabilization of that through, tulsi or ginger or haridra
Yeah,
or
so
turmeric.
what you are trying to say is that very well explanation of how bronchodilator, natural bronchodilator and basil and tulsi, how it affects, and it's very important to keep the tubes, the tube clean and clear. So on that note, thank you very much, both of you, first of all, and about the explanation. And on that note, Professor Sharma, shall we welcome Dr. Baljot now? She's our guest today, and would you like to? She's lined up, and over to you, Professor Sharma. Let's welcome her.
Thank you very much. And thank you very much, Professor Baljot, for joining, for sparing your time. We were classmates when we were pursuing our graduation. And so sometimes mistakenly, I address her as Baljot and not the Professor Baljot. So she will forgive me. And she is an expert in Ayurveda, obstetrics, and gynecology. And it's always a pleasure to listen to her. She has got her very unique concepts, and she is the most delighted to share it with everyone. And that is where we are fortunate to have her today as well. So over to you, Dr. Baljot, if you can enlighten us a bit about your topic.
Global Namaste, Professor Baljot. Sorry about that. And welcome on Healing Our Earth. Before we go ahead, let me just tell this to all our audience. We are worldwide right now connected with Facebook. We are live on Facebook, Twitter, Twitch, all our partner websites, and you can watch us live now. Over to you, Professor Baljot.
We can see your slides, Baljot. We cannot hear you.
Hello, now you can hear me?
Yeah, I can hear you.
Yeah.
Thank you.
Yeah, okay. Yeah, global namaste to all. My prayers to Lord Dhanvantri and my greetings to all the esteemed personalities on the dais. And thank you for giving me this opportunity to share my views on yoga and postnatal care. So here I will be discussing how yoga is an important tool in during postnatal period. So first of all, what is yoga? We have to have an understanding because yoga is correlated with asana. So it's just not asana. So the deepest principles of yoga are based on a subtle and profound appreciation of how the human system is constructed. The subject of yoga is the self, and the self is an attribute of a physical body. Unlike weight training and stretching, the system of yoga integrates three basic components, that is breath, pranayam, physical poses or whole body practices, that is asana, and meditation, that is dhyan. So, what is an asana? Asanas are a process rather than as final product. Most often, an image of an asana depicts the end point of a movement. So, mentally prepare for the asana by visualizing it and feeling it in your body. So I really like this by Indu Arora. Sorry. So asanas are, just a minute. So asana means to become that which you are going to practice. It is not make-believe, mimicking performance, rigidity, or adamancy. It is simply any body position in which the mind takes a seat, expands, and then triggers the extraction of the sanskaras, vikrutis, vikalpas, negative thoughts, and emotions held in there. This helps in peeling the layers of blockages, and the practitioner enters into the Anandmay Kosh. Asana stimulates the endorphin hormone, the feel-good hormone, which creates feeling of comfort to the body. So what is purpurium? Purpurium or postnatal period is the period following childbirth during which body tissues, especially the pelvic organs, revert back approximately to the pre-pregnant state, both anatomically and physiologically. Purpurium begins as soon as the placenta is expelled and lasts for approximately 6 weeks when the uterus becomes regressed almost to the non-pregnant site. So major changes in the body during purpurium, these changes can be categorized into physical, mental and emotional, and lactational. Now, physical changes, post-delivery, the body's ligaments and collagenous connective tissues will still be softer and more elastic than pre-pregnancy, and it will take 4 to 5 months for full recovery to take place. The uterus immediately begins to involute to its pre-pregnancy size, but the abdominal muscles remain in their over-lengthened state. This often makes the abdominals feel soft and flabby from muscle weakness, making it look enlarged with pressure of the intestines and abdominal organs distending the flexible muscles. In 66% of women, the vertical abdominal muscles become separated. The diastasis of the rectus abdominis muscle, that is diastasis recti, is defined as the abnormal separation of the right and left rectus abdominis, appearing as an increase in the width of the linea alba or interrecti distance. That is why pregnant women is always advised when they have to get up from the lying position, they have to take side and they have to get up. They should not get up from direct on the back. Then the occurrence of diastasis recti is more common in pregnancy and immediate purpurium. Diastasis recti tends to reduce the contribution of the abdominal muscles in trunk movements. As a result, trunk stability is altered and pelvic alignment is also altered, which leads to excessive lordosis and waddling gait. It may also lead to umbilical hernia. Now, mental and emotional changes. The rate of general anxiety disorder is higher during postpartum period relative to general population. Sleep is disturbed. Postpartum depression or postpartum blues is a significant public health issue, with approximately 1 in 4 women experiencing depression following childbirth. Negative consequences, including personal suffering, impaired social relationships, and social, emotional, and cognitive delays, are seen in exposed children. So it affects the children also. Then lactational changes, they are major decreased breast milk and soreness of breasts. Now, what are the benefits of yoga during purpurium? Additional care is needed for rapid restoration of women's optimal health during purpurium. Yoga is important among them. Various studies have shown that postpartum yoga encouraged pulmonary circulation and thoracic expansion and also strengthened the anterior abdominal wall muscles, thus improving their respiratory function. Also, abdominal muscle tone contributes to stability of lumbar spine. Women who exercise in postpartum period recover almost twice as fast as matched control subjects in terms of physical ability and emotional stability. So these two aspects need to be taken care of during purpurium, that is physical ability and emotional stability. Mothers sleep better and for longer time. Now, there's some of the clinical studies I'm sharing. The effectiveness of postpartum yoga on uterine involution among postpartum women in Indonesia. So, subuterine involution is one of the pathological symptoms of the postpartum period, which causes complications. This is indicated by the size of the uterine fundus, which is greater than the normal size, and elongated outflow of lochia. So, the uterus should become a normal pelvic organ in the specific time period. So if that doesn't happen, it leads to complications. So the study aimed to analyze the effectiveness of postpartum yoga on uterine involution. A quasi-experimental pre-test and post-test with a control group was applied in this study. 38 postpartum women received postpartum yoga in the intervention group, and 19 postpartum women received general postpartum exercise in the control group. The average difference in uterine involution before and after treatment in the intervention group was higher at minus 9.14 centimeter compared to the control group at minus 7.20 centimeter. So it was concluded that the gain score of uterine involution was greater in the intervention group than the control group. So the uterine size decreased normally and in a better way in the intervention group. Then postpartum yoga is effective to strengthen the uterine muscles, facilitate blood circulation, and stimulate neurohormonal activity. So it could accelerate uterine involution. So the next study is benefits of yoga in increasing lactating mothers' breast milk production. This study used pre-experimental method with one group pre-test, post-test design. Breast milk production in lactating mothers was measured before doing yoga and then measured after again after doing yoga. So the samples in this research were mothers breastfeeding infants aged 1 to 6 months who gave only breast milk without any additional food in the area of East Java province. The total sample was 30 lactating mothers. The effect of yoga on breast milk production of breastfeeding mothers is evidenced by the results of studies showing an increase in the average breast milk production from 84.2 ml before doing yoga to 195.17 ml after doing yoga. Then efficacy of yoga for depressed postpartum women, a randomized control trial. So up to 20% of women experience postpartum depression. Postpartum depression is associated with anxiety and poor health-related quality of life. Efficacious treatments are critical. Many women with PPD prefer complementary therapies. Thus, the current study examined yoga as complementary therapy for PPD. So 57 postpartum women with scores 12 on the Hamilton Depression Rating Scale were randomly assigned to a yoga or waitlist control group. The yoga intervention consisted of 16 classes over 8 weeks. Now, the yoga group experienced significantly greater rate of improvement in depression, anxiety, and the quality of life relative to the control group with moderate to large effects. The reliable change index analysis revealed that 78% of women in the yoga group experienced clinically significant changes. So these findings support yoga as a promising complementary therapy for postpartum depression and warrant large-scale replication studies. A gentle vinyas flow class was developed by certified yoga instructors with expertise in yoga for postpartum women. So during the prenatal period and postnatal period, the yoga instructors who are expert in this modality in pregnancy and postpartum, rather they should guide the postpartum women. Consideration was given to yoga poses used in previous yoga-based interventions for depression. So this is the chart, how they prepared the modality. So first they started with breathing and centering techniques, then warm up, then integrative poses were given, then floor stretches and relaxation were given. These were the various yogasanas and yoga poses. Then sleep is very important. One of the causes of abnormal regression of reproductive organ is lack of sleep. The quality of mother's sleep is disturbed by fatigue and muscle tension. This can be prevented by yoga-based physical exercise. It was proven from previous researches that the saliva level of alpha amylase decreased significantly and immediately after practicing yoga during all evaluation periods in yoga groups. The duration of nighttime sleep was significantly longer in the yoga. Now, what should be the yoga protocol? Now, various classifications can be considered. Now, according to mode of delivery, if it's a vaginal or normal delivery, yoga can be started after 1 week. If it's a cesarean section delivery, usually after 4 to 6 weeks or after the doctor permits. And usually, and no abdominal stretches are to be given in the initial period. Then types of asanas: standing, sitting, prone lying, supine lying, balancing, topsy-turvy. In all these positions, the asanas are given. Then muscles involved are vaginal and perineal muscles, core muscles, back and lower back muscles, and thoracic muscles. Then what are the main asanas which are indicated after normal vaginal delivery? Ardha Halasana, Ashwini Mudra. It is the counterpart of Kegel's exercise. It's just the same. So Ashwini Mudra, it has effect on perineal muscles. Then Sarvangasana, core muscles. Pavan Muktasana, Setubandhasana. These are very good asanas to be given during postpartum period. Then twisting is Kati Chakrasana, Markatasana, Marjarasana, Adhumukasana. Here lower back, tailbone muscles around perineum, core muscles and thigh are involved. Then in standing, Chakrasana, Parshvakonasana, Veerbhadrasana, that is back bending after 2 months should be given. Then shoulder and hand, that is Tadasana, Purvottanasana, Paschimottanasana, Gomukhasana. These all help in lactation also, and Surya Namaskar is also given. Then after cesarean section, for preparatory phase, start with walking. It's the best for increasing core strength. Then Setubandhasana, Ashwini Mudra, Shalavasana. These can be given. Prone and back bending asanas, that is Chakrasana, Dhanurasana, these should be started after 3 months. Then anatomical understanding of asanas, like in Tadasana, intrinsic and extrinsic foot muscles, quadriceps, iliopsoas, piriformis, abdominal wall diaphragm, these muscles are affected. Then coming to Veerbhadrasana, this is very important. Here, articulate pelvis, integrity of spine and action in legs. These are the main contributions. Then joints, spinal extension, serratus anterior, slight abduction of scapulae. Then front leg nutation, back leg counter nutation. So these all muscles and joints are involved. Then this is Paschimottanasana. Then Gomukhasana, this is very good for breastfeeding, and it relieves the shoulders also and brings strength in the shoulders. Then these are the all other muscles involved in the Gomukhasana. So yoga should be promoted as an integral part of postnatal period, as it will increase postpartum well-being, and having a program in this regard can promote some of the health dimensions. We can decrease maternal morbidity and mortality considerably during postpartum period. So happy and healthy mother is the foundation of healthy and vibrant society leading to healthy and progressive nation. So these are the references. And thank you so much for listening to me.
Thank you, Professor Baljot. What an amazing presentation. And first of all, it was really an enlightening. Professor Sharma, let's give her, first of all, big round of applause, everybody, because
So much.
the way you explained everything postnatal, postpartum, because as a female, I understand that how it happens, and because all the mothers who are there out there who are facing postpartum phase at the moment. So certain points that you mentioned, I mean, everything was amazing because I love muscles. My main main area of interest is muscles, but everything combines, isn't it? How you talked about core muscles, and Professor Sharma and Professor Rajan, our senior resident Ayurveda expert, and everybody is here. And it's amazing to discuss about this further. Before we take your comments, Professor Sharma, I would just quickly like to say that depression, anxiety, just few keywords that you said that which I feel that it has to be discussed. Muscle, core muscle strengthening, mind, body, everything, lactation. These are all amazing information that you shared. So let's take everybody's comments one by one. Professor Ish Sharma, over to you first of all.
I would like Dr. Rajan Patankar to start with, then I'll follow him. Dr. Rajan, please.
Very well explained. In my opinion, yoga should be our habit to do it regularly, because yoga is a nityam. Not only when means very well explained, but for each and every person, yoga is most important. And I shouldn't say it as a yoga, but yoga, because yoga is a niyam. So it should be performed daily and on regular basis. Very well explained. I think so. One of the questions from Miss Rushali was not answered. He went to take the laddus, and who can take it? So, sorry to say, but I inform it in a short time. The laddus which you have prepared are really excellent and can be consumed in winter season by anybody. But the prakriti of kapha prakriti patient can consume it too, but pitta and vata can consume only one. And pitta prakriti person can consume it with milk, and vata prakriti with ghee. It's more beneficial, because these laddus are prepared in our house also on a regular basis. So it's very excellent.
Thank you, Professor Rajan. Amazing. Thank you for that. And before we go ahead, let's take comment from our founder, director of Healing Our Earth, Mr. Kumar. What you have to say about the laddus, and what are your comments, please?
Global Namaste, Vaishali, Professor Ish, Vaidya Rajan Patankar, Dr. Baljot. It's so wonderful to have you all here. Dr. Baljot, just before we ask you a couple of questions on the social media that people are asking, let's introduce Dr. Anjali Agarwal. She is from India. She carries lots of hats, and one of her specialities is that she is a consultant physiotherapist, but she has got more specialists. So let's welcome her. Dr. Anjali, Global Namaste to Healing Our Earth.
Thank you, Neilji. Very good evening and good afternoon and good morning to everyone. And global namaste to everyone too. Thank you so much for having me here.
And how are you feeling at Healing Our Earth, meeting all these experts, including from the Ayush Ministry, Professor Ish Sharma, who is actually dealing there in Mauritius with so many gardens and Ayurveda and teaching people. How do you feel when you are seeing all the people, including our Dr. Rajiv Gupta and Vaishali?
So lovely to hear you, Dr. Rajiv, Dr. Ish Sharma, and even Dr. Baljot. Quite enlightening. And I think I also believe in holistic healthcare, something which is a combination of, your emotion, your physical, and your well-being, which is coming together. So thankful for, being here and having me here too. Thank you so much.
Superb. And next week in the Body and Joint X, you might bring your physiotherapy expertise to us. So we'll be lovely to have you. Stay around. We'll chat with you a bit later. And it's so wonderful. Dr. Biljot, your presentation was so good. And of course, 70% of our viewers are women. So there were lots of questions. I'm just going to summarize in a different one, particularly from Greece, South Africa, and Netherlands. I think it's a common question. When should women start exercise after pregnancy? Some say 6, some say 7, some say 8 weeks. Is there a particular time when they should safely start yoga and exercises, Dr. Biljot?
So after normal delivery, vaginal delivery, they can start after 1 week with simple exercises, stretching exercises. And when a cesarean section is done, we wait for at least 6 weeks. And
So is it
that
safely-
depends on female to female and what kind of delivery was that. Doctor can advise better that when she can start with the exercises. And after cesarean section, abdominal stretches are not given for 3 months.
So there you are. For the people who are listening, you asked the question, if you had a cesarean birth, you gave a birth by a cesarean method, then avoid for at least 12 weeks or even safely 15 weeks, then you are safer. But do consult your doctor who know better about you. It's difficult to advise online without consulting with you. And if you had a normal, very healthy delivery, then maybe even after a week, you can go and ask if you can do that. Or after 6 to 8 weeks, you are generally safe. It wasn't a difficult pregnancy, but do consult your doctors. Dr. Anjali, your hand is up. You want to make a comment? Over to you. Please unmute yourself.
Yeah, thank you, Dr. Baljot, about that answer. I also look after a lot of postpartum mothers as a pelvic floor physio. So we generally advise postpartum at least a week for if you've delivered normally, and if you've done C-section, to start your exercises after 6 weeks. But definitely look after your postures. Very, very important for all the new moms is how you're getting up off the bed, how you're turning out of the bed is very important, so that you don't harm the abdominal muscles, which are very, very sensitive in the first initial weeks of delivery. That's very important.
Thank you.
That was all. Thank you.
Feed the baby, that is also very important because they slouch the shoulders and stresses on them. So you have to tell them their position. You have to sit straight, have support in the back, and keep pillows. Your baby should be at your chest level. You should not droop down up to the level of the baby. So that we have to tell that mother that you have to maintain that position. So breasts are also remain healthy, and shoulder pain and cervical issues are not there.
Thank you, Dr. Baljot. Thank you, Dr. Anjali. Vaishali, you had a question before we will ask an NHS question to Rajiv Gupta. Vaishali, over to you.
Yeah, my question is a quick question. Like I being a Gujarati, Indian family, that when we see that there is a delivery in house, and then all that which is called sawa mahina, like 1 month and 5 days, I guess. So mom makes all these gond and all these laddus and all. But my question is it safe to have this much of quantity ghee when you have undergone C-section? Because some allopathy, gynecologists, they tell that, it is not advised until the stitches are being healed properly, and then you go on a ghee. So can anyone please light on that question? I'm sure some of the people like me in audience would like to know that. Over to Baljot ji, please. Or anybody who can.
All these things in moderation and according to the condition of the mother. This is the standard. It's not that whatever the earlier women used to take, that stamina is not there in the present generation. So you can take it in the little quantities, and since it's just not only the ghee, it's laddus, and we are giving it in the dal that way. So they can take it in little quantities. They can start from day 1 also. It's not that they have to wait till stitches are removed, but they can start from 2nd or 3rd day according to her digestion.
Okay,
And then and in little quantities, and then they can gradually increase that.
And
Sure.
Vaishali,
Thank you
you
so much.
and Vaishali, you love your
Maybe you
Vaishali,
can better.
and Vaishali, you love your laddus because you showed them earlier, which when Professor mentioned about dry ginger, and so basically a dry form in a powder form is more effective than a raw form. That doesn't mean you stop eating raw food, which is very good. It's still exciting. Before we move to Dr. Rajiv Gupta from an NHS point of view, Vaidya ji, has Ayurveda any role to play in pregnancy? Is there any clinical studies or scientific knowledge we have got that Ayurveda can help pregnancy?
Yes, yes, definitely, definitely. Because as from the first month, as per our granthas, the Masik, or as per the months, right from first month till 9 months, there are different type of herbs. The decoction of that herbs, if can be taken by a pregnant woman, definitely I had seen so many cases. The deliveries are normal. Not only that much, the born baby is healthy, fair, and very good also. So, for that purpose, because nowadays all are working women, so it prepare the decoction and to take it, it is a little bit difficult. So our madam, who was a teacher to us, uh, Vidyatai Jalukar, has prepared those tablets which can be taken easily by a pregnant woman, and that is from right from the first month till 9 months. They are definitely beneficial. Thank you.
Thank you, Dr. Thank you, Vaidya ji. We'll move on to Professor Ish Sharma in a moment from a different perspective. Dr. Rajiv Gupta, you are an NHS doctor here, who is a part of the mainstream system in United Kingdom. Has NHS actually encouraged yoga and Ayurveda or integrated health in pregnancy as yet in United Kingdom?
So the answer is yoga. There is special yoga classes for to be pregnant mothers and the pregnant mothers, and that is supported by the NHS, partly because it helps in better delivery. It increased the respiratory tolerance because you know that during the contraction of the uterus, during the pregnancy, the mother feels breathless and the whole abdomen is practically occupied by the baby or fetus, and it presses the diaphragm. Therefore, your lung capacity is already smaller. So yoga is definitely promoted both during the pregnancy and also postpartum contraction of the uterus. So that is there. What is not promoted is the herbal medications, which overall are still we as a part of a big integrated care and on behalf of the International Organization of Integrated Health Practitioners, and I'm luckily the chairman of the advisory board of that. We have been pushing to get the scientific evidence so that we can present to the NHS that these things are beneficial. What is the active ingredient in each of them so that it becomes scientific proof. The third thing, which was in old women India culture, was daima. She would do malish of the abdomen, and that was done in a specific way that help in the contraction of uterus, but also increases the milk production, which is what Dr. Maljot has said. So that science, I think, is still quite useful. It is not as much promoted, but there is gradually increasing postpartum yoga and in some way Ayurveda being introduced in a very soft and subtle way. And I hope in next few years, we plan to do some more seminars, public education, because it is cost effective as well as simple and non-toxic. So why should we not do it? So that's the plan to do it. So
thank you, Dr. Rajiv. So that's the good news, is that NHS has finally woken up and they feel that the centuries or millennium old methods are also working, because 500 years back there were no hospitals or doctors. You would just have a delivery at home, and a lady would come, she will just make a curtains round, and out comes a baby crying and say congratulations to you. We see that in a film, and that was actually true, but there were so many deaths as well. So this is very good. Professor Sharma, do you feel that it is yoga that helps women, or is it the meditational side of the method that calms the mother and hence the good delivery or good pregnancy, or even the children are feeling better and sukoon, or is it a combination of Ayurveda, yoga, and meditation?
See, yoga is much older than Ayurveda, and the most important takeaway for me from Dr. Baljot's talk was the milk production increasing from 84 ml to 195 ml, which is more than double. Now, this is not some plain nutrition, If the mother is not producing enough breast milk, then we can supplement it with another milk, like dry milk powder or baby foods. That won't serve, because the immunoglobulin A, out of the 5 immunoglobulins, IgA is released with mother's milk, breast milk, that will give the lifelong immunity to that kid. So it is much beyond nutrition. It is all about his or her lifelong immunity. That's very, very important. And a very important threat during the pregnancy is because of an increased intra-abdominal pressure. Blood pressure goes up, what we know as a pregnancy-induced hypertension. That is where, if you can reduce some of that blood pressure, because you cannot reduce the intra-abdominal pressure, that will grow with the time up to the 9th month. But if you are practicing yoga and you can keep the other blood pressure triggers under control with meditation and mild activities, then the risk of PIH, which causes IUGR, intrauterine growth retardation, that surely will go down. So very useful, Dr. Baljot, very enlightening talk. And we look forward to listening more and more from you, Mr. Neil.
Thank you. Thank you, Professor.
Yes,
Professor
Baljot.
Baljot, before you come in, Dr. Baljot, before you come in, it's wonderful that we men are giving our opinion. Well, let's ask some women as well who maybe have had children or something. And these two next wonderful souls are going to be the guests for the next hour in a while. So let's welcome Julie and let's welcome Christian. Julie, are you a mother, and what do you resonate from this chat?
I am a mother, and I would have loved to have been offered yoga and Ayurveda during my pregnancy and delivery. I'm sure it would have helped a great deal. I've seen the benefits from my daughter's perspective of the meditation side of yoga. But it's been fascinating, and it really does need to become more mainstream because it's cheap, it's effective, it's easy to deliver, isn't it? And it's also self-directed. And there's lots of information out there that would help. I guess it's how do we promote it? And there's so many scientific studies out there now. It's just getting them into the right arena for the NHS to listen, and also for people to be able to access information in their own right and be self-directed in their own healing.
Thank you, Julie. And Julie, stay around because shortly you are one of the guest contributors, so we'll be visiting you back again. Stay around and you're welcome to Healing Our Earth. Rajiv will invite you. And thank you for your comment that, yes, you would have loved to have had Ayurveda and yoga. So it's people like you who can help people like Dr. Rajiv Gupta to put, not pressure, to put education into NHS to bring it to fruition. Christian, global namaste to you and welcome to Healing Our Earth family. And Christian, are you a mother?
I'm a mother of 4, yeah. So I've done it in all sorts of stages and ages. And I would also say, I don't think I'm a Pilates instructor, so there's very little I know about yoga apart from my occasional self-practice. But it's also it's never been something which has been offered neither in Germany or in South Africa, where sort of my children were 1 there and 3 there were born. And it was always called the prenatal exercises, and which are very limiting, as we all know, because it's whatever the instructor believes in that moment. And it's mostly breathing exercises and so on. So, but with my last child, she's now 18, I was already teaching as a group exercise instructor all over the show. So she grew up at the gym, and alone to have the sporting background and the relaxation through participating in sporting activity was already meditation for me in itself. Meditation itself, I only learned once I had my children, because I strongly believe you need it from time to time. And I actually taught also my children then to meditate, which especially my youngest one, to just get her anxiety levels down. I spoke to Rajiv about it earlier, about the course I'm doing in the moment, and it gets a bit off subject, but it's about mental health and so on. And we are not actually growing up in a bigger family anymore. I mean, my family is part in Germany, here in the UK. I live now in the UK, and oh, that's great, thank you. And so I'm just answering to the chat, so it's very. I lost my train of thought now for a second.
So thank you, Christian, for sharing your knowledge as well. Stay around. Shortly, you will be one of the guest contributors that Rajiv will actually bring you in a while. And Kunakshi Balna also is a Pilates instructor. So Kunakshi, you can join in a bit later with your comments. And Christian, you're a friend with Vaishali as well. So she will connect you with Dr. Bajot Kaur, and as will Rajiv. We can exchange ideas, and you can get more knowledge about different other aspects from Ayurveda, yoga, and all this, because this is what we do at Healing Our Earth. We unite people globally to share and exchange ideas for the better of human mankind. Stay around, Christian. We'll be with you a bit later. So, Dr. Baljot, as you can see, people are appreciating with what you have come up with. So maybe we'll bring another session to it. Dr. Baljot, stay around. We'll take a comment from Vaidya Rajanji, just a quick comment. Then we want to move on to Nalini, who is here, and Rajiv will Rajiv Vaishali bring Nalini in a moment. Vaidya Rajan Padankar, your comment before we move on to the next sector.
Yes. Very well explained, and a good interactive action was taken up by so many experts. In my opinion, the word integration should be analyzed. As per Ayurveda, I think so, that the integration should be, because WHO has developed a very excellent center in Jaipur. That is very good. But people of our pathy, that is Ayurveda, should know the strength and weakness of each science. That is from my point of view, because the good things which are from allopathy or which are from modern science can be definitely taken up. But while diagnosing a patient, that should be and must be through only Ayurvedic scientific way. That is my opinion. So thank you very much, because Rajivji is more expert on that. So he will also comment on that. So thank you very much.
Thank you, Vaidarajan Patankar, Vaishali, and Rajiv. We move to the next section where we've got three exciting guests lined up for us. And the first one is Nalini, who is beaming with a smile, and she wants to share her knowledge. Rajiv, let's give her a mini introduction. Rajiv, Vaishali, let's welcome Nalini to Healing Our Earth, and let's move on. Over to both of you.
So it's great opportunity that Nalini is here today. I know Nalini for many years. We have worked on National Forum for Health and Well-being, and she has been one of the speakers in the global seminars that I held during the COVID time. And it was like there was some of these has more than 10,000 attendees in these seminars. And she has got a knack and skill of understanding the whole concept in a very systematic way and sharing it. Not only this, like yoga, Ayurveda, she has understanding of that, but more importantly, energy healing or Reiki, where Kushal Bai, who was supposed to be with us, actually delivering the talk initially and couldn't do it because of his own personal problems. Nalini has come in, and despite I'm so grateful that she was traveling and she is traveling, she has made a slot to come and talk to us about this important topic, because in medical science, there is system, there is tissue, there are organs, and there are cells which make the difference. But on the other hand, there is something vitality or energy that makes person live or die. Prana, the prana healing. And therefore, it's so important in our recent national seminar. And in fact, the health Mela, I and my wife both have experienced it personally through Kushal Bhai and his team, who actually does it selflessly. And Nalini is one of the most important pillar delivering it. So without further ado, I know you need to go. So Nalini, can you just share with your practical skills and benefit the audience how this energy healing work and how people can use it in their day-to-day life in
Okay,
order to
thank you.
benefit?
Thank you, Professor Rajagupta. Thank you. Namaste and good afternoon, everybody. I am traveling, so if there's a bit of background noise, please excuse that. I'm representing the Holistic Living Group,
Nalini,
and I'm going to.
can we stop the car, because it looks like your video is moving up and down.
I have stopped the car. I had a bit
Ah.
of a malfunction. My laptop's not working, so I'm actually on my
Fine.
phone, so that's why.
Your phone is fine. You're looking very nice. Carry on.
Okay, so I'm going to talk about Reiki and its use. Reiki actually means universal life force energy, and it's one of the most highly energetic energies in existence in the universe. It's not based on any religion or any group or anything. It's available for everybody to use. In fact, we're all actually born with Reiki, because Reiki is energy in itself. It's completely universal and not based on any religion or any of the thought processes or any paths at all. As I said, everybody is born with Reiki because it's energy in itself, and it's one of the most highest forms of energy in existence. So if I just explain how Reiki actually works, how it actually works is it works by releasing blocked energies that are within our energy centers, predominantly our 7 chakras. And once that energy is released, then it balances these energies throughout the body, promoting a sense of calmness, well-being, feeling good, feeling that connectivity as well to the universe and everything around us as well. It is the system of natural healing. And as the lady previously just mentioned, Reiki is also very self-directed as well. So you're quite in control of it as well. In terms of Reiki, individuals would have to be attuned to Reiki, and they have to be attuned to Reiki by a Reiki master or a grandmaster. And actually, we do have Kushal Bai on the call today. He did have an appointment, but it was cancelled, so he is with us today, which is brilliant. And the reason why I've mentioned Kushal Bai is he actually is a Reiki master and a grandmaster as well. So as I said, Reiki, it has to be attuned to individuals. So a Reiki master, would be a channel for this universal energy to flow from them, from the universe to the individual who is being attuned, which is also known as initiation as well. What Reiki master would do is they would open certain energy centers, which is known as chakras. We have 7 chakras within the body. We have more than 7 actually, but the main ones are 7. Excuse me. You've got your crown, your third eye, your throat, your heart chakra, your solar plexus, your sacral, and your root. So what a Reiki master would do is he would open up these energy centers, which then allows for individuals to access this higher energy this universal force energy at greater force and at a greater volume. Now, in terms of Reiki, you know, there's various different types of Reiki, but the one that we adopt is very much a hands-off approach. So we don't touch individuals. What we do when we give Reiki is we place our hands on the various seven chakras throughout the body and allow the individual to draw as much Reiki as they need. So the individual doesn't consciously draw the Reiki, but their chakras will automatically draw Reiki as much or as little as they need. The giver is not in control of how much an individual receives. What happens is once the individual draws the Reiki to their energy channels, which I've referred to as chakras, he or she will release, activate, distribute, and transform this energy as their body needs in terms of healing their emotional, physical, mental body, and subtle body as well. One rule we always adopt is Reiki is always asked for and never given. So an individual would probably say, can I have some Reiki? And we would say, yes, that's okay, because it's about free will and it's not about imposing Reiki on other people. There is an exception to this rule, and that is when there's an emergency situation. In those situations, it is okay to give an individual Reiki. Actually, Reiki is it's quite an amazing thing, and I think you really have to be attuned to it and practice it to realize the benefits of it, because it's not just for people. You can give Reiki to animate and inanimate objects, which includes trees, animals, anything around you. It's really quite amazing as well. It's very subtle, very gentle. There's nothing harsh about it as well. It also works holistically on individuals. It works on day-to-day ailments such as cough, colds, headaches, migraine, hay fever. It also helps with emotionally related disorders such as insomnia, anxiety, depression, and it also works on acute and chronic conditions as well. It's very good in terms of working with those conditions alongside allopathic medication, Ayurveda, homeopathy as well, which I'll come on to a bit more as well. Just moving on to the benefits of Reiki. So it really revitalizes the body and the soul. It helps to create a spiritual equilibrium within the individual. It helps in terms of enhancing their general well-being, mental health well-being, emotional well-being as well. How it works, it works on cleansing the individual's spiritual body, emotional body, mental body, physical body, and their aura as well. As Reiki flows through the chakra systems, it moves across to the endocrine glands, which reduce various hormones as needed by the body to help with healing. And it's amazing because it just goes to wherever you need it to go. I remember initially when obviously I was introduced to Reiki, my knees were my focal points, and I was very much, no, it's physical, but it wasn't physical, it was more emotional around insecurity. So it just goes to where it needs to go in the body at the various different levels, such as mental, emotional, physical, and your aura as well. The beauty with Reiki is that it can be a standalone treatment, especially if you want to relax, fall asleep at night, have a sense of calmness, well-being, but it's excellent to be used alongside other alternative therapies, including allopathic medication, such as Ayurveda, homeopathic medication, treatments such as cupping, use of magnets, etc. So if I give you an example, in terms of cupping, I don't know if anybody's tried cupping, but it's very painful, especially for the first minute or 3 minutes. It's very painful. So what Reiki would actually do, it would relax the body, ensure an equal distribution of energy throughout the body, relax the person so that the person is able to manage the cupping, but that any treatment is absorbed at a much, much deeper level than it would have done otherwise as well. So it provides total relaxation, release of negative energies, negative vibrations. It also helps with resolving, healing individuals, situations, past experiences as well. You know, incidents that may have happened in childhood as well. It helps in releasing vibrations and energies that no longer serve you as well. I've talked about Reiki, what it is, how it works. I just want to give you some practical examples and personal experiences, to be honest, because I think that works quite well. Because Reiki, it's not theoretical. It's not you take a textbook and study it. You really have to practice it and then understand it to really feel the benefits. So, you know, a few of my personal examples. My mum actually had a brain tumor. Obviously it was terminal. She was in her 80s. So chemotherapy wasn't an option for her at all. So the doctor obviously advised that we went down the road of radiotherapy, which within radiotherapy, somebody of that age, it can be quite harsh. My mum did lose her hair, but the other side effects that one would suffer as an experience of radiotherapy, such as sickness, headaches, migraine, loss of appetite, my mum experienced none of these side effects. And that was actually due to, you know, Kushal Bai and another master who came and gave my mum Reiki before the treatment and day after the treatment. And she had a session of eight sessions radiotherapy. And on each one, immediately after, she was bright, bubbly, none of the side effects other than losing her hair. And I experienced that personally as well. With Reiki, there's various different levels. So you've got Reiki 1, Reiki 2, and Reiki 3, which I'll come on to as well. But once you progress to Reiki 2, you're actually attuned to distant healing symbols. So that means that you can time a healing session at a certain time. So it could be at 11 o'clock at night or 9 o'clock in the morning when you're quite busy. But it can also be used to make events happen. I was traveling down to London with my family. I live in Preston. So if anybody knows, with the traffic these days on M6, it's at least 5 hours. And we had to be at a funeral in the morning for 8 a.m. in the morning. We were cutting it tight. We left about 3 a.m. in early morning. And I actually programmed Reiki into my journey. And my intention was that we would reach there in time for the funeral. And that is exactly what happened. As the departed arrived, we reached there as well. And I've traveled to London many times, and believe me, that's not that's not down to chance whatsoever. Another example that I want to give you is one of my colleagues suffered third-degree burns due to a barbecue. He was very, very poorly in the burns unit in Lancaster, very, very, very ill. And he actually asked me for Reiki. And he was quite a non-believer, but because he'd spent a lot of time, we were colleagues for years, so he got to know me. He used to hear my stories of Reiki, and when I'd go on courses, he'd hear about it. And I actually offered him, would you like some Reiki? And he said, yes, I would do. So I was sending him Reiki. It was every couple of days. And within 3 weeks, even the doctors were quite amazed at the speed of his recovery. And he was as well. So, you know, as I said, it's a lot about using it, practicing it, and experiencing it, rather than reading a textbook and thinking, I get that. It's very practical, is Reiki. Over the years, Reiki has been modified a lot, especially during COVID. There's been lots of individuals offering attunement over the internet. Obviously, everyone's entitled to their own opinion, but our holistic living group, we actually believe in more of a hands-on approach, one-to-one, where you actually experience the deep level and the deep essence of Reiki as well. As I said, in terms of Reiki, there's 3 levels. So you've got Reiki 1, which is very basic. And although it's basic, it's very, very powerful, because that one is very much around self-help and focusing on yourself. In terms of Reiki, it's very, very important that as an individual, you've detoxed and healed yourself as much as you can before you're able to offer your services to others, because there's a danger of then passing your emotions onto individuals, your feelings during the session as well. So the course that we offer, Reiki 1, it's over 3 weekends. And within that, we offer the Reiki course, Reiki attunement. But before that, we spend quite a lot of time on pranayam, which I know has been talked about as well, which is we focus on pranic healing, oxygenization. And as an individual, it's really very much about self-healing, self-help during the first level, where you completely detox your body at a physical, mental, and emotional level. Yogic breathing is very, very powerful in terms of releasing toxins, calming one down. Once we've gone through that, which is the first part of the course, we're then attuned by a Reiki master, which is Kushal Bai, and that ensures that attunement takes place at a much deeper level. Alongside that, we also look at homeopathic remedies and Ayurveda as well, which really promotes the person's natural healing process rather than reaching out to, please, apologies for all those doctors out there, reaching out to allopathic medications such as paracetamols or going to the doctors, etc. Level
Great.
2.
That's fantastic. Nalini. This is
Have I
really good.
talked too much?
No, I think it was very, very useful, very powerful, very passionate, coming from heart. I was just conscious that
Took
you,
time.
yes, this is fine. It's great. So, what 3 important points you would say to people that they can bring into their day-to-day life straight away?
I would say be open. It's very much about self-healing. So be open, self-healing, and that is just not, Reiki is not limited to individuals. It goes further than that, to trees, plants, for garden lovers, as well as while you're talking to your plants, you can give them as Reiki as well. So it has many uses and many benefits alongside other medications such as allopathic, Ayurveda, homeopathy as well. Very complementary, very holistic.
Thank you so much
Thank you.
for all your
Thank you.
time, and please have a safe journey. And Kushalba is here in case we need some more questions, but we might just crack on and then we'll probably put the panel together. Thank you very much once again.
Can I just have a quick, I'd just like to really thank the Healing Our Earth platform and the members for organising this, for giving us an opportunity as well. Thank you, and all the best.
Nalini ji, thank you so much. I have a quick question. First of all, before I go ahead, let me congratulate you for enlightening all of us. And what an amazing start you said that, the cosmic powers are always flowing to and through us, whether we are aware or not.
Or not, yeah.
Or not, right? So the right way, how to channelize the energy, how to be aware of those cosmic powers which is flowing to and through us all the time, 24/7, without we being aware. And Reiki and energy healing is very much concentrating on that, I feel. And also you talked about cupping, and so that is something that, because I'm a chakra healer as well, when you talked about energy centers, it instantly clicked me and to the audience. So the few points that I felt that let's recap quickly, that to tell all our audience that self-healing, just now you said, self-healing, that word is so powerful that if an individual is aware of self-healing, their own healing journey, and if everybody is taught the right way, that how to heal their own physical trauma, mental trauma, childhood traumas, without we being aware, every individual on this earth has been through some or the other types of trauma in their lives. And energy healing is a new medicine, new medication. Yes, definitely that it is not a replacement of paracetamol.
No,
it is not a replacement of a chronic surgery, a chronic illness which is needed, like
needs
a
to happen, that's right.
abscess, a tumor. It has to be taken out from your organ. But if on an early stage, what we understood at healing our earth and our audience that if awareness is developed through energy, through the chakras, through the energy centers, then we can always prevent the damage. Dr. Rajiv, I'm also coming back to you, but I'm not a medical person. Sorry, when I'm speaking on this level, but I feel that if we are all being taught in a way that self-healing, if we reflect and if we can go inward, all I understood is that going inward through Reiki, through different processes, and when we become aware of number one, acceptance, and then it can be healed through balancing the energy centers.
Energies.
Is it what you are trying to say?
That's completely right, Vaishali ji. And also, I kind of, I do want to emphasize that, in terms of X-rays, hospitalization, operations, they definitely need to go ahead. We're not saying, you don't need to do that, definitely, but it helps with the healing, it helps with managing. And also another personal example that I want to, obviously I'm at that age where I'm going through the change, the hot flushes, sleep, everything, but the Reiki helps me to relax, it helps me to sleep as well, but I am still having my other medication alongside it, but it helps me to cope and manage much, much better.
And that
Thank
is
you.
absolutely
Thank you,
true.
Nalini. That was very well done. Rajiv, let's say goodbye to Nalini and we welcome Christian, who is our next guest, and let's welcome her. Over to you, Rajiv.
Thank you so much. So I think the session is going so deep, so intensely helpful that we kind of always think that, yes, there is more to share with our audience in order to help, because all of us, as Nilkumar said and Vaishali said, and all of us are here to help people, to make difference in life of people, not through one or the other system, because each system or discipline of medicine, whether it's allopathic medicine, Ayurveda, homeopathy, chakra healing, aromatherapy, music therapy, dance therapy, hypnotherapy, all of them are having some basis. These are all, I always say, these are tools in your toolbox. Take out the right tool, use it in right way, and help. And hence, we have got a Pilates instructor, a friend of mine, Christian, who is a very inward-looking person and has been a very, very experienced and has been doing Pilates for a long time, originally from Germany, but back in now UK. And we had so many different conversations. And she has got a proper thinking of what happens, how it happens, and how this can be done. And now I know we had some differences in opinions because of some people feel allopathy and other disciplines are opposing each other. In theory, they are not. There is some area of convergence, some area of divergence. Where there is convergence, we build on it. Where there is divergence, we build bridges on it. So with all that, let me bring Christian. And she's going to share about Pilates. Then we will have Julie Greensmith. She's going to talk about hypnotherapy. And also, I think because we are over in the time, I think Pritika is also somewhere. So I think as time slots, we bring her back. She's going to talk about stress management as well. So let's bring Christian here. I know because there are so many questions we're trying to pull together and it takes time. So that's off to you, Christian. Floor is yours.
Thank you, Rajiv. I'm not 100% sure where I should start or what I should talk about.
Talk about what Pilates is, how it can help the people who preserve the health, and also if there is departure from health in particular conditions where it can help. Just talk it through. We'll make it interactive. We'll ask questions as we need.
All right, let me start with my own experience with Pilates first. I hated Pilates. I've been teaching any adrenaline living exercise in the health and fitness gym since 1992. And so quite a long while, and I loved it. And but I had always lower back problems. I had been physically and emotionally in severe relationships where my back got injured and so on. So I had always issues about that, which it actually came to a point at one stage where I said, I cannot teach anymore step classes without pain, but that was something what I therapeutically needed, the music and the exercise. So I needed to do something about it. And my physiotherapist suggested Pilates. So I went to a Pilates class, and I've never walked out of a class before, but I did then. And I really didn't enjoy it, and how it was conducted taught me a very big lesson for my teaching experience, is that you have to connect to your client. And if it's maybe also, yes, on an energetic basis, but you have to certainly, there has to be some sort of chemistry between you and your clients so that you like each other. And you have to interact with them in a class, be it on an individual level or being it, because there's so much more. I'm sure it's the same with yoga and any other practice. You have to, you have a human being in front of you, and there are two human beings interacting. So they need to be on the same wavelengths, otherwise this ain't working. So I then decided that Pilates was something for a bored housewife and elderly women, and I'm never going to do this in my life. Then I went through a very difficult divorce, and I needed to look after, I had then one young child still at home, and I needed to have one way where I could be with her and earn money at the same time. And so I met by accident somebody who had her own Pilates school, and overheard her teaching to a client. And she then, I thought, this sounds very different. That is a lot more down my wavelengths of what I want to achieve, what I think about humanity and humans and so on. And I started a year-long individual course because of the language barrier. That was in South Africa. And sometimes when the accent is slightly different or something like this, then I was also afraid to be older than the other people to ask questions. Anyway, I did the Pilates course, absolutely loved it, but I had to stop in between to have my own back and knees and everything treated, which again taught me an important lesson that there are you cannot just, there's no textbook for it. I don't know who I think for the Reiki was it. There's no textbook about it. Yes, there are the exercises you're supposed to do, and you have to do them in this sequence, and 10 of this and 10 of this and so on. And at the end, everybody might as well do Pilates with a YouTube channel, because that's not interactive teaching. And so we actually turned my whole curriculum upside down and so on, until I was strong enough to do all the exercises which I wanted to do. I have an advanced Pilates certificate, and I had a very strict Pilates teacher, which was not an ego trip, but in hindsight, I think that was the best thing what could happen to me. I then opened my
So
own
Christian, tell us more. So you had this problem. What other conditions you think this is most helpful?
Most people who come to me have either flexibility, mobility, weight loss issues, or actually come for what's the word, rehabilitation. And that can be obviously various minds and or various ideas. People often think that you have to be a certain size when you come to Pilates, i.e. ballerina size, or you have to be flexible and to do this, which is absolutely not true. That's why one of my taglines is always Pilates is for everyone. And we start where you are, and we go what you need. And that is the journey. That is your journey. It's not my journey. So it's your journey. So Pilates is an incredible good strength training tool, because you're using all your muscles in your body, using all the stabilizers, and which you, when you go for a run, not necessarily using, but you do need them. So I often train sports persons also to prepare them for their events, or make them stronger. From the flexibility of the point, it's also not being flexible, not mobile. It means pain, and in a certain age, that means also that is existential, because if you can't, I always say, if you can't get off your floor yourself, you have a problem. Because I have quite a few elderly people, if they can't get off the floor and they live on their own and they fall, that we're having a really existential crisis here. And so I work with them together. But as it so often is in Pilates classes, and in most classes, yoga and so on, the mind works as well. Often I end up not only as a psychologist, but also saying, connect your mind to your body, and the breath to your body, and all the advantages which come with that. You focus. You are you leave the outside world outside for a while, because this is just your time and nobody else's time. You're with your breath work, and learning to breathe. And that was something really, really important for me. I had to come out of an incredible anxiety stress state back into my own, and breathe through that. And I often do this just for 10 minutes, or sometimes just Pilates, just to calm down and be in my heart again, and it's just not in my head. And yeah, does that help?
Perfect. That's very helpful. So I think that's brilliant. I'm just thinking that stay around. We have got Julie coming in that a few minutes time. How would you see that? I always have this question that the physical body, mind, and soul, which is the holy thoughts, and in the medical field, there is kind of nothing described as such. It's all physical. So mind is brain, heart is heart in a different way, because it's all a mechanical function. So where do you see a scientific coupling of the physical side and the energy Pilates mind side?
I find it
in
always
your mind?
surprising. If you think about, if you're having an accident, or just before you should have an accident, and you just pass it, your adrenaline and your cortisol and insulin, everything just shoots up like crazy. All your stress hormones shoot up like crazy. And so your whole body works together to produce it. How can we say that they are two totally separate points and two totally different issues? If you are in a mental stress situation and you're going into fight and flight, your whole body reacts to that, not just your head. So you cannot separate them at all. What we often do, we are too much stuck in our head. I'm a prime example for it. And we have this little washing machine voice in our head telling us what we need to do and what we need to think and whatsoever. But if we close our eyes for a while, or we're doing something where we solidly focus just on that, not on the outside problem, then we're in sync again with heart and soul, and we actually have the mental capacity then thinking that problem through and really asking, is that true? Is it really happening like this? So there's so many examples in daily life that mind and body and soul work together without even having to go into Pilates or into yoga and so on. It's just often medical, not people who can't think out of the box. They are sort of creating separate entities, but I think we're past that a long time ago. Also, probably, hopefully, with most medical practitioners. I have a nursing training behind me. If I would have said that 40 years ago, everybody would have looked at me if I'm not quite right in the head. but we're going to come a long way with mindfulness and actually really doing everything mindfulness. Yet it should have really called not mind, but mind bodyfulness, isn't it? Because it's the whole body.
Yep, I think that's brilliant. So nice. I think it was fantastic listening to this all. And people call me, I'm exceptional because, majority of people who are qualified medical doctors, they stay in medical field and they do not think or believe or accept this all different methods, which are very good in filling the gaps. And it's no reason just not to bring it together. As Nalini said earlier, that the Reiki, the energy healing, the yoga, all can work together, provided we have right frame of mind to bring it together. So amazing. Thank you so much for your help. Stay around. I'm going to bring our next speaker, Julie Greensmith, who has been, I'm proud to say, we have been students together when we were doing the coaching qualification. So it was a diploma in executive and corporate coaching. So it's three of us. We were going from Yorkshire together to wherever, London, Milton Keynes, Latimer, wherever. And then we were studying, I and Julie were studying together at home because it was a quite difficult, quite complicated course. But also because of my natural inclination outside my medical world, the hypnotherapy, we also did, like I've done the whole NLP, the hypnotherapy, timeline therapy, etc. So we have crossing of our paths together, and Julie is one person who has impressed me all the way through. We have then delivered courses on emotional intelligence with Drew. He was my other third colleague. So I, Julie, and Drew together, we have delivered multiple courses on understanding the emotions, changing emotions, self-awareness, self-management, the team management, etc. And that was very, very popular. And we delivered it to the doctors. So you can understand that this whole spectrum works very, very well together. And hypnotherapy can be used for pain, it can be used for chronic diseases, it can be used for depression, anxiety, and variety of things. So let me bring Julie. Would you please mind sharing where it can help, how can it help, and if you can have some practical tips, and if you want to run a mini session for a few minutes, please do. So let's welcome Julie Greensmith.
Thank you. Thank you for that introduction. Hypnotherapy is ancient, and all hypnosis really is self-hypnosis. You cannot hypnotize anybody who doesn't want to be hypnotized, and all hypnosis is natural. We go into it every day. It's when our mind is automatic, when we're driving the car, we're not noticing the journey, but yet we're driving safely. We're in automatic patterns, automatic modes throughout the day. And hypnotherapy helps when we can just be aware of those automatic patterns and habits, the speech, the narrative that gets in the way, that tells us that we can't, or we're stupid, or we shouldn't, or we mustn't, or all the negative things that we talk about to ourselves, and everybody talks to themselves. So hypnotherapy helps you to access your unconscious patterns. It allows you to come inside of yourself and just defocus from the everyday world. And one of the important things about hypnotherapy is the whole act of eye closure, because when we close our eyes, we're shutting down an awful lot of activity within the brain, and it helps us to come inside. And I hope you'll join in with me in a few moments and just experience that for yourself. As regards to the practice that I've had for over 25 years, it does help with a lot of medical conditions. It's enabled people to be able to have surgery carried out because they were too scared. They were absolutely terrified of going in there. So it's all about teaching them how to relax themselves, how to switch off certain sensations. It is recognised by the NHS for certain conditions such as IBS is a 6-week protocol that is run by the NHS, and also for temporomandibular joint problems. We're hoping to get more in there. It's recognised for anxiety and PTSD. It's a natural process, as I've said, it really is. I think there used to be a lot of myth around a fantasy that I'm going to swing a watch in front of your eyes and I'm going to have the metronome, or you're going to have to look into my eyes and it's all going to be circular. It's nothing like that. I think the best way to experience it, if you haven't already, and I know that many of you will have, and I know that many of you will do meditation, because the crossover between mindfulness, meditation, and hypnotherapy, it all really rolls into one. They bridge together. It's all about using your mind and focusing inward. However, with hypnotherapy, there is a specific goal. So it might be that the person is coming because they want to reduce pain. And the way that we would get them to reduce pain levels would be to get them to connect with an idea, an image perhaps, of what the pain looks like, feels like. Does it have movement? Does it have colour? Does it have a temperature, a texture? When do you notice it? We'd get them to really think about and focus in on what that pain is. Then we'd put them into a more relaxed state by, again, it would be the eye closure, just gently guiding them through some relaxation processes, and then getting them to think about how it would look healed. What does it look like when it's comfortable? You know, how will they know? And we bridge those, we weave those images together so that it brings about reduction in pain. I think one of the most interesting clients that I ever had was a man who had a grade 4 glioblastoma brain tumor at the base of his brain, which was inoperable. He was in terrific pain, well, I'm sure you can imagine. And he came to me not to cure him, because obviously I can't cure anybody, but it was how can he deal with this pain? And we got him to connect with what he thought it looked like. And he thought it looked like a block of plaster at the back of his head. So I said, well, what do you want to do with it? And he came up with his way of that every day, twice a day, he was going to go in his imagination, he would close his eyes, he would relax himself down, and he would imagine that he was chipping away at this block of plaster, at this tumor. And his wife said to me, every time he does his self-hypnosis and he's imagining this, his nose runs. Why does his nose run? Well, we can't really answer that other than something's happening. And when he was going for his scans, the tumor was actually shrinking down, and they couldn't explain how his tumor was shrinking down, but it was. So from him having been told he'd have 6 months, he actually survived 2.5 years, and he managed his pain quite well. There have been other people that have been really plagued with irritable bowel syndrome. They haven't felt comfortable leaving the house, because very shortly after leaving the house, they would be looking for a toilet and needing to go. They'd be having to evacuate the bowels. So again, it's about getting them to relax, sitting in the chair with their eyes closed, getting them to connect with that area of the body, and bringing in some kind of soothing, healing imagery. And I'll usually get them to imagine that there's a warm orange glow, and we talk slower and lower, and you can see when somebody's starting to relax. And then I would encourage them to come up with their feeling of comfort, their experience of it, to make it more personal, because it's a very personalized approach. It's not just about you read a script. It's much deeper than that. You get into the person's psychology, into their imagery, into metaphor. We tell stories. So we bring them into from the delta wave state, where they're really relaxing. Sometimes we can actually see rapid eye movement when they're processing something, like you would see in REM sleep. So the everyday brainwave pattern that most of us are in are the beta waves. And that's when you're normal processing, you're conscious, you're awake, and it can go into high beta, where we're stressed and anxious. And we gently drop down to alpha, which is a more relaxed state, when you can see that the body's starting to go. And then we drop them down into theta. And that's where the magic happens, if you like. But it is about switching off the stimulation that we're all getting all the time, whether it's external or whether it's internal. And one of the ways that we do that with hypnotherapy is we induce eye closure, which I don't say your eyelids are feeling heavy, blah, blah, blah. Sometimes we do if the person needs that approach, but I just invite people to close their eyes. So is it appropriate, Rajiv, that I
Yeah,
do a little bit of...
absolutely. Go into a session, let us experience. So, or yeah, practical session, please.
Okay.
Let's have some hypnotherapy.
So I would like to invite you to just close your eyes. And with your eyes closed, I'd like you to notice the unique colours and shapes that you see behind your closed eyelids. It might be black or grey. There might be a hint of a colour. You might notice blobs, lines, indiscriminate shapes. But as you keep focusing on what you see through your closed eyes, you'll notice there really is nothing to bother, nothing really to look at or disturb. You've closed your eyes on the everyday sights and colours and places and faces. You're entering into that space inside your eyes. And perhaps you can get a sense of the depth of that colour that extends outside of you. A space that you could drift out to. A space that's all around you, but also inside you. For that colour extends inside your mind a sense of space, your own space. And right now, there really is nothing else you need to do, nowhere else you need to be. Just notice the colours and shapes and how you feel right now. And perhaps when you're ready, you could take 1 or 2 deeper breaths in through your nose and out through your nose, and open your eyes again, just noticing how you feel now compared to a few moments before you closed your eyes. There is no right or wrong. Take your time. So, hopefully, there was a little bit of quietness, maybe a little bit of stillness, because those are the important parts of leading into a hypnotherapy session. And those are techniques that I actually encourage my clients to use regularly. If they're feeling stressed or they're feeling things are building up, I'll just remind them to maybe just spend a few moments to close your eyes, to come in, to switch out from the everyday world. You know, there's lots of other small self-hypnosis techniques that really do begin to dampen down the stress that's building. We take people through physical relaxation exercises as well, but also we're encouraging the switching off of movement, because if you've got the eyes closed, the brain's not being distracted by what it's seeing, it's not searching, you're switching down some of that hyper arousal state that a lot of stressed, anxious clients are in. A lot of clients are constantly in fight, flight, freeze or fawn mode. So you're shutting down that stimulus, but you're also encouraging the body to be still. So when there's eye closure, there's no movement, the body is still, you're starting to come back into parasympathetic nervous system. And there are lots and lots of clinical studies that show the effect of hypnotherapy, from it reducing high blood pressure, for it having a positive influence on heart rate variability, on it reducing blood sugar levels, it's reducing cortisol and adrenaline. There is so much research out there, but it is one of the, I think it's a very accessible model. And once the person knows, has been shown and taught the techniques, it is, you know, a very self-healing model as well. And self-hypnosis is encouraged by me. And it's made a difference to a lot of people's lives, not just with the physical conditions of pain and IBS and, you know, even tinnitus, the noise of tinnitus that has become unbearable for some people. They've been able to tune it out. But the emotional side of things, so people with PTSD, even people that have been on the verge of suicide, and unfortunately, hypnotherapy is usually the last port of call for many people. They've tried everything else and they're desperate, but it is such a simple thing. We have gone into schools and taught it to people, and I think if we can get these kind of models in, the whole of it, you know, the whole mind, body, spirit, the energy medicine, if we can get that in at a very early age, then, you know, we might not be having some of the problems that we've got with people, with especially with the increase of mental health issues. So I hope that you have found this informative. And if there are any questions, I'll be happy to answer if I can.
So amazing, Julie. I'm so thankful to you that within a short period you have talked about it, what the hypnosis is, and you more importantly talked it is to be asked or invited by the person, and also self-hypnosis that can be used in day-to-day life for changing our own system, body healing. And I think a beautiful short demo which was so useful and powerful. You got two, one is question from my other colleague, Kushal Kumar. Is it same as guided meditation? Guided meditation, and also Vaishali has got some other questions. So sorry, Kushal, do you want to ask your question, or Julie, you can answer the question within the time frame, and then I hand over back to Vaishali as we have got lined up.
Rajiv, first of all, I just wanted to congratulate Julie for making all of us aware and our audience aware about the different state of the mind and how we can, alter the state of mind, and altering the state of mind can affect your healing process. So it's all about frequency, energy, and vibrations, isn't it, Julie? That's what you are trying to say, that it's not about any particular technique, but it is just about frequency. And if you are able to tap into that field of energy, and the moment you feel whole, you are able to heal yourself. I feel that that's what the conclusion that we can say this to our audience. And before we go ahead, I just want to again mention that we are live at the moment on Facebook, Twitter, YouTube, our website, our partner website. So all our audience, stay tuned for all these wonderful, enlightening sessions. And over to you, our founder director, Nil Kumar. What are your comments, please?
Thank you. Thank you, Vaishali. It's going a wonderful session over here. Rajiv, thank you for bringing Julie. Julie, you had a nice mini session. We're going to ask William, who has got his hand up. He wants to make a comment. William is from USA. He is a Transformation Global Project person, which Keith will introduce in a while. William, you got your hand up. What comment would you like to make what Julie said? Over to you, William.
Yes, thank you. Good morning. Julie, that was a beautiful experience that you took us through. I wanted to thank you for that. And you mentioned education, and you put it so eloquently that if we get this to kids at the earliest age, because you know what the data or what the science shows is that children are in an alpha state most of the time up to about age 7. So it's really natural. And then we forget how to do it. And then that's where all of our problems start. And so the Global Transformation Project, we'd be really interested in connecting with you, globaltransformationproject.org, because we're pushing for a United Nations resolution, a non-binding UN resolution, to advocate mind-body education to public educators all over the planet. And we feel like this is the fastest way that we can do it. And in 2015, the General Assembly of the United Nations voted in to create the International Day of Yoga. And they voted it in with a record number of co-sponsoring nations. So for the same reasons that we're pushing for the Global Transformation Project. So yeah, we could just, I've taught, like yourself, I've taught in health systems and hospitals for about 35 years now. And they haven't embraced it nearly to the level that they should. And it's such an uphill battle trying to get the medical system to, really embrace it the way they should. But if we got it into education, it would just head off so many problems, societal problems. And I've taught in prisons. And so it would solve a lot of violence issues in society, and it would virtually empty our prisons to have kids learning these kind of things in school. So what you're pioneering, doing this in education, I think is really so important.
Yeah, thank you. I guess the message is trying to get across at an early age that it is us that have the power. It is us that have the control over how we think, how we feel, how we change feelings. It's not about external substances. And unfortunately, we're in a society that does encourage us to get lost in external substances, into addictive sugar. Even things like sugar. I'm not just talking about the obvious things like the marijuana, the weed, and everything else. But nobody teaches that in school. Nobody teaches the children how to use their mind, how to control even their emotions and some of their feelings and their worries. So it's really in school, just teaching those little sessions, even just little short relaxation sessions, because they're not going to put it in as the big stuff. But if you get the little stuff, you get the basics, and they understand and they can see that it's a tool. Because I do work with children as well on a one-to-one, and I've got them back into school when they've not been able to go to school because of the anxiety and the fear. And it's wonderful to see them taking back control, even if that's just through the telling of a story. It's like, how do you connect with that child to get them to understand and then to use their imagination, because their imagination is so rich, it's so real, but it's not, their imagination is not encouraged in the school system. So even just having little 15-minute, 10-minute story imagination breaks, and again, if that's not being taught in schools, maybe it can be part of the home life. Maybe it's something that can be accessed on another platform, because I really do think it's important. It's crucial, really, if we're to stop this epidemic of mental health problems.
Thank you, Julie. Yes, at Healing Our Earth, we've been encouraging every organization, every country, every government where we go to reach. Let's go through the children, because if we can start now, we might actually sustain and improve humanity. Stay around. Vaishali will connect you with William. Julie, Vaishali is now friends with you, so and Rajiv and Keith and everybody will connect you to William. He's part of Healing Our Earth on a regular basis, so you will connect, and let's grow together. We'll take a quick comment from Kushal, because we need to move to the next slot where Kit Sharp will be bringing a lot of guests. Kushal Kumar, welcome, and your quick comment, please. If you could, yes.
It was wonderful talk. I really appreciate very much. But like she said, Julie, that you hypnotize yourself in many ways that you do in your everyday life. We do a kind of a guided meditation where we take the person into, guide them into, and get the, like mind over matter. So we just want to get over the matter and just work on the mind to bring them to a zero level when they don't think anything, they're just gone. And we bring them out through breathing, because otherwise they will not come out so quickly. My question is the technique looks very similar to the guided meditation. Is that true?
It is very similar, except with the hypnotherapy, there's a lot of exploration beforehand. So it's about getting to know that person on an individual basis, so that it's not as directed. The guided meditation is wonderful because it deals with the physical level of stress. It deals with letting go of some of the thoughts, calming down the brainwave activation, and dampening down the sympathetic nervous system. So
That's
from
right.
that aspect, it has the same goal, the same outcome. But with the hypnotherapy, we allow the individual to come up with their own imagery. So then it veers off from, so we give them space and we'll use idiomotor signaling. So that might be that I'll set up a signal from the body, which could be a finger movement, it could be a head nod. So I'm allowing the person space so that they actually do the work. They come up with the guided bit that they need, the imagery, the change that they want to make. So if they're working on a physical problem and they've got sharp pain, and I would be encouraging them to find the images, the stories that are around dulling that pain, cooling it, what color, what sensation, how do they know? So it's more personalized, whereas with directed, you would probably encourage them to think about a color, think about a shape, think about a temperature. But it does really, at the end of the day, it achieves the same thing. You've got physical relaxation, the brainwave activity has come down, you've decreased cortisol, and the person's more relaxed. And that's a very important part in healing. It's all about relaxing, switching off that fight, fright, and fleas.
Thank you, Julie. We need to press on to the next section. Julie, that's the reason why this episode is called Integrated Health. Kushal Kumar, thank you very much. You regularly support Healing Our Earth, and NFHW obviously is a part of Healing Our Earth too as well. So together we are building a family and we bring so many facets of integrated health. And now we're going to go to Keith Sharp, who is a lead at Healing Our Earth for Tai Chi, Qigong, and various matters. And he's got lined up some exciting speakers for us. So Rajiv, let's enjoy Keith Sharp for next hour. And then we will all again for 1 hour chit chat as a group chat and see how we can integrate further and bring this healthcare combined so that it can help humanity. Global namaste to you, Keith Sharp.
Global namaste to all on Healing Our Earth. Special thanks to Rajiv for being host, and to Neil and the rest of the team, especially Nishat, who I could not proceed without any confidence at all without his technical knowledge. Right, I'm going to endeavour to talk slightly differently to the specialists, and Julie, I consider you in that specialist arena, which I'm not. I'm more of a generalized person. I wish to welcome some of my friends to provide their own personal view of integrated care. Following an introductory input from myself, and then from around 4:30 p.m. or just after, we will have the pleasure of Bill Douglas, the founder of World Tai Chi and Qigong Day, to speak about his global transformation project. And of course, we will then be inviting people to ask questions and see what we can do. All right. As we have some flexibility in the latter part of the session, this QA session is really a period for people, speakers that I've invited, and anybody who has a contribution of a positive nature. All right. I've asked myself a number of times, what is integrated care? I'm going to try and summarize it in my own view as a layman's terms, which may in time become a mantra for the future. Oh my goodness. Here it is. Fusion of evidence-based complementary therapies joined with the medical professions for the health, well-being and lifestyle of our communities. I then did some research with our friends from the National Health Service here in the UK, and I came across their statement. I've lifted it from a recent Facebook page, so it's relatively new, and this is their statement. The NHS Integrated Care Statement, ICS, is a vision for a more holistic approach to health and care that puts patients at the center of care delivery. The ICS, the Integrated Care Systems, aims to improve outcomes for people by empowering patients, providing care in the community, working together, setting standards, delivering high quality care, attracting and supporting people. My experience with dealing with national health and social care started in 2002, and here we are 2 decades later, and we're talking about the same thing. So I'd like to begin with soliciting my friends, and my first activity is a small interview with Dr. Roger Yanker, who I have known for a number of years. And if we can show his video, I'd be very pleased, because Roger could not make it today. So double click to enter full screen mode, which is on.
Hello.
Okay. I have with me today Dr. Roger Yanker, a 2CM doctor, traditional Chinese medicine doctor with years of Tai Chi and Qigong experience and leadership, who is providing us with his view and thoughts on integrated care from a USA and global viewpoint.
Yes. Thank you, Keith. Thank you for organizing this. It's a very important topic, and appreciating all who are listening in. Integrative medicine is now called, in the United States, it's called integrative health and medicine. And so over time, from alternative medicine to complementary medicine, holistic medicine, and integrative medicine, it's now integrative health and medicine, which means that there's some consciousness around the topic of self-care. In other words, people taking care of themselves. So we're getting done with the whole idea of a healthcare system that's not a healthcare system, and we're getting going with the idea that we have a healthcare system that includes taking care of one's health. And so that is moving into policy. It's been, it's taken 50 years, but it's moving into policy now to the extent that acupuncture, chiropractic, osteopathic, naturopathic, homeopathic, and a number of other types of medical traditions are included, are being more included in addition, self-care or mind-body practice, qigong, tai chi, yoga, mindfulness, and all the other wonderful mind-body practices from all the great cultures around the world are making their way under the umbrella of self-care and mind-body practice. And so it's a very exciting time. I particularly personally have had a lot of experience with yoga and meditation. Somehow Qigong and Tai Chi have just hit the sweet spot for me, but I think it's a beautiful, wide array of, shall we say, options and services that over time will be integrated into policy to the extent that individuals can actually choose to pursue the healthcare methodologies that they prefer, and in many cases be funded by the National Health Service or the National Institutes of Health, as we call it here in the United States. So a very powerful, profound, opportune time, super exciting. And I think it's just like one of the most exciting things that could happen in our lifetimes. I'll say one more thing. In politics, when people separate themselves out into perspectives, it is very common for everybody to be on the same page about health health maximization, health improvement, and so it's like it's transpartisan. It goes beyond political views to sacred ideals held by all humans. And I'll leave it there.
Okay. Well, that's fantastic, Roger. What I would ask is, what is your opinion of, shall we say, the global activities that we need to address?
Yeah, it's interesting because integrative means everything integrating. And so if you think of Chinese medicine or Ayurvedic medicine, or even the traditional medicines of all the cultures in Europe, the Celts and the Druids and the Vikings and the Hawaiians and the all the Asian societies, they all have a inherently integrated type medicine that includes taking care of yourself, taking care of your family, and preventing disease instead of treating disease. So that's common in every culture before the colonial era. Since the colonial era, and particularly lately with what some people like to call scientific medicine, or particularly pharmaceutical and surgical medicine, what happens is that the trust in the ancient ideas, which are common across all cultures, collapses into people being misinformed, and so just about every culture in the world has gone through a process of thinking that Western scientific medicine is better than their own traditional medicine, which is absolutely not true. And so I think that probably every culture that exists, except for in the backwoods, where people are living on small farms, and in maybe even tribes that exist even today, most of the cultures or societies or economies in the entire world are going to have to overcome this misinformed trust in the fact that scientific Western medicine is preferred to their own traditional medicine.
That, sir, is perfect. That is wonderful. And I think that we both want to see prevention as opposed to cure. And I really thank you. And I will stop recording. Record. Wow. I thank Nishit for putting that on, because that was the first occasion I had to record anything on Zoom. We've got a couple of minutes, and I just want to refresh our memories over some incidents over the last couple of decades. We now hear that again that we're going to have integrative care systems. We had a Health Act in 2000 run by John Milburn. I think that was who was in the health activity at the time. Health Act to combine primary care and social services. It never happened. Egos, controls, it never happened. 2016 to 2024, we have further acts which are virtually the same. Too much to read. What has happened in the last couple of years is that we've moved on from, in England, over 100 clinical commissioning groups, CCGs. I've bashed my head against them a few times, but we now have integrated care boards. So from over 100 CCGs, we now have 42 in England integrated care boards. We need to break the pattern of their non-cooperation. I have tried many times. Oh, you don't have the right skills. Sorry, that is not the case. We go back to our statement, fusion of evidence-based complementary therapies. There's plenty of them around. However, here in Hampshire, in the UK, we have a an old hospital built for the Crimean War, which is now a small museum. And I've visited it a few times, and they have a lovely display of some of the old medical practices. And one of them was a showing of a very early version of an X-ray machine, under which, and I love this, coming from an engineering background, prevention is better than cure. So I'd like to move on now, and I have down a colleague of mine from the far regions of Great Britain, which is Pembrokeshire in Wales. And I'd like to introduce Frank Farrar, who has become a very good friend and a supporter for me. And it's over to you, Frank. Thank you very much for your time.
Thank you, Keith. I hope everybody can hear me okay. Yes, it's a great thing that we can have. We're looking to make this integration. I come from specifically a Qigong point of view, very much so, although I do practice Tai Chi and other things as well. I use my skills to bring people together because that's something I have. I have created my own sort of integrated system within just my classes and within my friends. I have students who come to me who are already involved in these things. I have Reiki practitioners. I have yoga practitioners. I have a kinesiologist, people that are interested in many other things, including nurses from the NHS who come to my classes because they realize there's something that needs to be moving forward. So we're creating our own perspective of that here, far away from everybody else. This part of Wales I live in is very much almost the end of the universe some ways. So things take a little longer to get to do here, but we create things ourselves because we have a great community network here. And so consequently, the word spreads across, and we teach people who have problems that are similar to sort of problems with mental health issues, people with issues with things like dementia or Parkinson's or autism is another thing that comes along. And they all fit in. And by adjusting what we do, and particularly with our Qigong exercises, we can get them to become involved in something they didn't think they were going to be able to get involved in. And it allows them to, through breath work, through the movement, it makes everybody relax and come back to a place where we're all together as one in the room. And that very much is the key to the way that I work, to get that, to make that happen. And we invite people to come along. There's particular free sessions that are done every so often. I've done a little bit of work with our local health board and also with our local council's leisure team, where occasionally I may get asked to come in and do a session for just everybody. And it's good because it means that people are thinking that way. I think that encouraging people to think that way is a great prospect to make things move forward. Then we can show that people are interested. If enough people say they're interested, then hopefully further down the line, those that Keith was just talking about, those that really seem to be holding and dragging their heels, will get to see that there's a big movement towards that. And it's very strongly happening with Qigong now here in Pembrokeshire, at least. And I know from further afield, because speaking to colleagues and also other teachers here in Pembrokeshire, because there are a few of us, that they're very interested in doing that. It's making an effort to make that happen that is worthwhile for all of us to do. I have yoga connections too. I have more yoga teachers here than Qigong teachers, but they're starting to be interested in it and saying, well, what can you do that we can combine with? So that is happening. And as I say, our community spirit here is very strong. When people come from outside and see that the people here talk to each other and make things happen without so much of a thing relating to local government or even central government coming down, we're big enough to say, we're doing it, and we just get on with it.
Okay, but thanks, Frank. All right, trying to keep a little bit of control over the time. And as you know from my background, I'm a devil for project management. I'm going to move on now from Welsh and to Dorset, which is just down the road from me. And a colleague I've been talking to for over, I don't know, Robert, about 3 or 4 years now. Robert Joyce of Elemental Tai Chi. and we had to have a legal discussion because I actually put in down his wrong title. So a few moments from you, Robert Joyce, if you may, please, if I may, please.
Thank you, Keith. Thank you. Just a really small bit about me. I've been training for about 24 years. I quit my corporate job in 2012, and I've been running a Tai Chi school down on the south coast of England for the last 12 years, full time. I've taken over 4,000 seated Tai Chi classes for nursing homes and care homes. I've done 6 3-year studies with the NHS and Bournemouth University Dementia Institute. And on the question of integrated care, there's one thing that I've definitely noticed, which is the worm is turning, as it were. Sort of 5-10 years ago, to get any type of sort of response from doctors at a ground sort of grassroots level was nigh on impossible, because it was, what is Tai Chi, what is Qigong, what is that about? Last week, I had a call from a potential student to join one of the 7 public classes I run, specifically recommended by their doctor because they had fibromyalgia and for the benefits of Tai Chi and Qigong for pain, etc., etc. I've had students that have been quizzed by their doctors, my improver students in the improver group, which represents probably about sort of 4 years of training, 4 or 5 years of training with me. One doctor in particular was examining the muscle structure and balance of a student that attends the improver classes, and was actually surprised and was like, well, what do you do? Because your muscle structure is better, your balance is strong. And they were quizzing this particular student about me and my background, and about so I think there is slowly some people are getting, the doctors and nurses and things are getting an understanding about the benefits. I did a lecture at Bournemouth Hospital with a number of doctors and consultants, and it was in relation to a very small niche benefit of Tai Chi, the improvement of balance, which the NHS likes because I think the Kinsey report stated that it was evidence-based exercise. But the lecture that I gave, which was a good hour or so, was literally about how and why does Tai Chi, etc., improve balance. And this type of education to that sort of level of doctors and consultants, I feel is really important, because it starts to educate them as to, oh, well, actually, I've got a patient here, which I've got a huge waiting list for a hip operation, what have you. Can I get them to go to a Tai Chi group, et cetera, et cetera? And hopefully, things will slowly change. I think it's an uphill battle. I think there's an awful lot of politics within our industry itself, which I think is something that needs addressing. But Julie's mention about the sympathetic nervous system and the parasympathetic, which is very much what we're interested in terms of resilience to stress. The last online thing I did with was 150 corporate lawyers of Coca-Cola, and it was simply some very basic qigong, and really a method of integrating the getting the parasympathetic nervous system engaged as opposed to the sympathetic. And the responses from these people are actually quite often surprised. I had a client from a Japanese pharmaceutical company after an hour-and-a-half session actually state, how do I recover from this feeling? Because they felt so relaxed and grounded. And the quote was, I feel like I need to go and get a coffee. Whereas my response is, well, that relaxed, grounded feeling, that should be normal. That's your normal functioning. So yeah, I think there's slow and gradual integration. But I think if there was any sort of coordinated effort to win hearts and minds for this type of practice, it's going to be in the education, almost at a grassroots level, with the local doctors, with the local surgeries, and getting them to understand, that they can nigh on triage their patients to people that are in the local area that are doing Tai Chi and Qigong, for those benefits that those things bring. So that's, I've run over, Keith. You'll be cross with me. That's over 4 minutes.
No, definitely not.
Thank you.
Anyway, no, wonderful. I really appreciate that. I do have this challenge to try and keep to a timetable, and I've just had a message from Neil. We've got plenty of time, so don't worry. So thank you for that. I just want to ask Bill if he's okay for time, because I've now pushed back a little tiny bit because I've moved Robert Hay in a little bit earlier. Are you okay for time, Bill?
Yeah, I'm just fine. Proceed however you need to, Keith.
Okay, right. Thank you very much. Okay, well, I'm going to move on to the northeast of our country now. And a lovely lady I met a couple of years ago, she has a wonderful personality. And in working in Newcastle, which I used to class in my marine days as nothing more than a shipbuilding area. And now it's anything but. And has a fantastic football team. And I recall having a program from Newcastle United football team, all signed by many people going back into the 1950s. I wish I'd got it today because I could have sold it for a fortune. Anyway, I'm gonna hand over to Wendy, and please listen, this is a lovely lady, and she has got her mentor from Florida, Joe Aber, here as well. And welcome, Joe. Nice to see you. Thank you very much. Over to you, Wendy.
Hi, so Keith told you that I'm a lovely person, so I shall not disappoint. And Keith has asked me to talk about social prescribing. So I don't know whether you want any of my background. Is that important, or do you want to know?
You carry on in whatever way you wish.
I studied, so I spent lots of years studying as being specialized in hematology transfusion, worked in an NHS, of course you do. And I decided to quit, and I did an MBA and went on and did my own thing and had my own business since then. Always been interested in the physical mobility and strength. So I do call myself as a mobility and strength coach. So when I was very heavily involved with Olympic weightlifting, and I actually injured my own shoulder. And I thought, right, okay, I need to actually do something to, rather than all these very intense activities. And I seriously went back into doing Tai Chi for my own recovery. And in the midst of that, I realized this is a really, really good system for those people who might not can or want to do conventional exercising. And so I went off, did various different kinds of other qualifications in mobility and strength, so that I can, my eyesight is really terrible. It might not, since Robert, I also have, worked with elderly people in a nursing home for 15 years. I was also very, very privileged to be involved with an NHS up here, and I was at the psychiatric hospital in Gosford. I went there every week, and also it's another psychiatric, like an A&E, if you like, for mental health, Hadrian Clinic once a week as well for a few years until COVID hit and everything just oof. So I started probably 5 years ago pushing for this social prescribing. Because I've got my, if you like, the conventional training in medicine, I don't think we should say poof poof to that, and we don't need it at all. So because that is really for acute, it's really good for acute medicine, but definitely prevention is better than just trying to cure. And a lot of the time they don't cure, I have to say, they just working on symptoms. They're trying to treat the symptoms rather than the root of the disease or the health issue. And I think that's where, or actually going med, all these other things can become very, very beneficial. So I've listed here 6 things that I'm sure you can think of more. So perhaps it will help us to how do we become a supplier in the NHS? So when the GP going on her screen or his screen for, so I don't know, like hypertension, just say she clicks on her screen and there's a list of medicine that comes up which she could prescribe for this particular patient. And hopefully she going Tai Chi the Way of Life will be on that screen. And so that's where really I want to get to. And that's how they will use, or they're never ever going to use any of these, whatever we're trying to put out there within the NHS. That's my knowledge of it so far anyway, in my experience, but I could be very, very wrong. Maybe we need some more. So social prescribing, rather than just popping the pills, so writing prescription, there you go. You know, I've seen you for 2 minutes, taddy bye, go to the chemist and get your pill for the next month or so. So instead of that, that's where it's, so instead of giving you a pill, a prescription for go and do something. And that comes to somebody else said about self-care. Yes, it was the recording you had, Keith, with the gentleman on that video. Can't remember his name. Sorry. So anyway, so it's good for mental health and physical. We know that already. For those who really, really stress at work, so it will be a time, say there was this prescription for he or she to go and do a Tai Chi class for a block of 10. And so it's that time, because that individual is learning something new, it actually takes away the mind and thinking about work and whatever it is, because you can't do two things. Well, I know you can, but while you're learning a new thing, I think you actually an hour away from being stressed about work. For those who's not at work, probably there's the unemployed, and because they're learning a new thing and they gain confidence in learning a new thing, and it's quite an unusual thing they're learning. So it gives them a sense of achievement, something to talk about with their friends and their family. And if they really get really passionate and good with it, they might start to show these movements to their friends. I've seen them doing that. They tell me they do that. So it's for other people to actually appreciate their achievement. So it's you know, adding on to, well, giving them this person confidence in thinking, oh, actually, I might be able to do this job, or, you know, it's just opening them up. And I particularly think that Tai Chi Qigong classes would be much better. I know the UK weather doesn't really, it's not great, but outdoor, something about outdoors. I always run my classes outdoors, whether it's snowing, raining, gale force wind. Very, very rarely I have to Zoom a class. And it's actually really have conditioned most of my students to still do that out in the cold, in the wet. So it is, it's, I can't remember the article, but especially when it's rained, go out there and you breathe in that air because of the microbiomes in the soil, is actually really, really good for gut health. So, and if you've got good gut health, you've got good immunity. So outdoors, and also getting people out, especially in a dark, cold weather in the UK, it's very, very easy for those who are already, say, elderly people, doesn't do very much already and sit in the house and not going out. So it will give them just something to go outside and get them outside. So lots of people already touched on about how it is very, very good for balance and depression, anxiety, stress, or even the other way around, really hyper people, because of the yin and yang. Your ground was taught properly, then, you know, you will balance out the not too much yang energy going up, and that's why you're so hyper, but you just ground the person by rooting. But I mean, I'm not here to talk about Tai Chi techniques today. So but also it is also strength. There's a lot of strength work involved. So you're not just improving mobility because you're moving, the fact that you're opening the joint and lengthening the muscle, again, I have to, because that's the ethos of Tai Chi Qigong, you will have improved muscle strength. So I need to pull back to the social aspect of it. It's a group of people learning something together as well. So every week you go to a same class every week. You're going to meet the same bunch of people all the time. And I see them, they get together and they go for coffees after the class. So there's definitely a very social aspect. So that would kind of address the problem of people feeling lonely, isolated, excluded, whatever reason, they're not getting on with their families, whatever it is that's going on in their lives. And this clearing, so if you're not anxious and you're not depressed and you're not overthinking things because you're a bit hyper, then, you know, your mind's a little bit less foggy and perhaps just life will be. Am I too long? Last one. Number 6. So I am going to just read this, I think. Is it particularly good for those who are not very active? I said that right at the beginning. That's what I got myself into, because I see that it's quite a gentle way to get people back into being active as well. I know there's other social activity they can do, like knitting or painting, but with this, it's you've got the added physicalness of the activity, which I personally feel, because I love all this kind of strength and training and mobility training. So of course I would say no, physical activities. So yeah, it's just teaching. So this last little bit would be, it is the fundamental of Tai Chi Qigong. I believe that Tai Chi Qigong can relieve stress and all that if it's taught properly, by connecting the whole body as one and move in harmony. That can improve mental health. It is the ability to open joints rather than compressing joints, and muscle not contract, not relax, but lengthen. That's improve the physical health.
Wow. Fantastic. Even without a North accent. Right.
I didn't.
I'm going to bend a little bit, adjust some of this work here, because I've got myself down to talk about the Chartered Institute for the Management of Sports and Physical Activities. Unfortunately, Colin Huffin, the Associate Director at SimSpa, is unavailable, and I can then bring this in maybe later when I'm talking with Bill, because I think that some professional activities are aligning with the Global Transformation Project. But once again, thank you to Wendy. Thank you very much indeed. And I'm sure we'll be in touch many, many more times. And I'm now going to jump from the north of England to this wonderful little country called Austria, where Robert Hay is a gentleman. And it wasn't until recently that I found out that my original teacher, who likes to stay in the background, lives in Thailand. And Robert said, "Oh, you know so-and-so." And there was a thought that the three of us could get together at some stage, but I'm not so sure that my travel insurance is going to accept that. So Robert travels extensively, and he, in his own words, will describe what he actually does. But everywhere he goes, he introduces Tai Chi and Qigong and other systems. So, Robert, without further ado, please spend some time to chat.
Okay, thank you, Keith. Well, Qigong has certainly changed my life, and I came from a nursing background. I actually nursed for over 25 years, and even as a young man, and the early days of being a RN, I wasn't convinced about the system that I was working in. And there were times when I just wondered how anybody got well at all in hospital. People were going home. They didn't know whether they were better. They didn't know whether they were still sick. You had to tell them. There was a massive dissociation between their mind and their body. You had to, either the nurses or the doctors would tell them that they're well and you can go home now, or you're sick and you have to stay. And there was just, for the person themselves, there was really no self-knowledge about how they were. And so it was a very disempowering system that I was working in. And even then I knew that there was something not right. And there was certainly no integration. There was no integration within the individual. And in fact, that was discouraged. You were told how you were. You were told what you were, where you were. And if you asked somebody how they were, they would say, well, I don't know, you tell me, you're the nurse or you're the doctor. So this is the kind of system that people were being put through, and in the name of health and wellness. And for me, I think 20 years ago, I branched out, I guess. I started learning Reiki, and I also learned aromatherapy. The aromatherapy was at the Institute of Herbal Medicine and Aromatherapy in London under a guy called Gabriel Mojay. And Gabriel's an acupuncturist, he's an aromatherapist, he's a shiatsu practitioner. And this aromatherapy course, which was 2 years, had a Chinese medicine base. And that was my introduction really to Qi, as well as paralleling that, I was learning Reiki. So the whole concept of Qi and the body's energetic system was becoming known to me. And I realized that to do this, to do aromatherapy and to do the Chinese medicine, diagnostics, I had to learn more about Qi and my own Qi system. So I started to learn Qigong. And I can remember the first lesson. It was just such an amazing experience, and just even holding a static posture and feeling Qi, feeling that energetic pulsation. I thought, wow, something going on here. And so in order to practice it, or to treat people, or to really teach, you really need to have your own feeling and concept of what your Qi is. So so coming along from that, I studied Qigong. I went to the Elemental College of Qigong in London, and I spent over 4 years there learning to teach Qigong, and we went very deeply into it. I also then, as a natural progression, I went exploring the different teachers. I went to Thailand, and that's where I discovered Keith and my mutual friend there in Thailand, who remains a mysterious person and will do so. And so the Qigong and the Tai Chi, and it's just been a wonderful voyage of discovery. And as anyone knows who does Tai Chi or Qigong, you never stop, and there's no black belt, there's no end. It's a journey without end. And what we want to achieve is an integrated movement of Qi. So there's that word again, integrated. So in order to bring integration into our healthcare system, we first have to find integration within ourselves. By transmuting the different forces within our own body-mind, we bring an integrated movement of Qi within ourselves. And that's basically what we're doing with Qigong. And teaching Qigong also takes it to a new level, because in order to teach, you've really got to keep at it yourself, and to reach, to keep exploring. And I like to call it creativity. And I think that with myself and with my students, I like to say it's about creativity. And we are creative beings. And so the beauty with Qigong and with Tai Chi is there is a big element of creativity and exploration of movement. And within that movement, we find a certain freedom. And I think that enhances the Qi flow. And I think that just the concept of Qi, and I think with bringing Qigong and Tai Chi into the healthcare system of the NHS within the UK, people will ask, what is Qi? Because Qi it's a Chinese word. There really is no translation. There's no direct translation of what Qi is. You can say Qi is energy, but it's more than that. You can say it's electromagnetic, but really, I guess Ted Kapchuk, who wrote a very famous Chinese medicine textbook called The Web That Has No Weaver, he described Qi as being energy on the verge of becoming form, or form energy on the verge of becoming matter, or matter on the verge of becoming energy. So it's somewhere in there, and this exploration of Qi. And for us as practitioners, it's important to get a feeling of what that is. So it's experiential, and the more we practice and the more we do it, the more we get this feeling of this energetic Qi movement. So really, in bringing this to our healthcare system and being able to actually translate that into a language that the authorities want and will understand, we've kind of got to bring it into the physical model, because the Chinese anatomical model is an energetic model. It's not a physical model. And the Chinese, they always studied wellness. They didn't study sickness. They studied wellness. They didn't study cadavers or diseased bodies. They studied wellness, and they wanted to know what kept wellness, what kept people well, what kept them healthy. And there's a story that the wealthier families in China would employ a doctor, and they would pay him a wage, and as soon as someone got sick, they would stop paying him. So it was all about the wellness, and I guess we call that preventative care now. But the body's an amazing system, and the body does work towards homeostasis. The body works towards wellness, and you give it the right conditions, and it will go there. You just have to get out of the way. And I suppose we talk about the autonomic nervous system, and of the two branches of the autonomic nervous system, we have the sympathetic and the parasympathetic. And really, it's the sympathetic that is really gets in the way a lot. And that's our fight or flight. And then we've got the parasympathetic, which is the rest and repair. And these two systems, they're always there. There's a balance between the two. Every time we breathe in, we engage the sympathetic nervous system. Every time we breathe out, we engage the parasympathetic nervous system. That's why in a lot of traditions, they like you to breathe out a little bit longer than what you breathe in, just to engage a little bit more that parasympathetic side of the autonomic nervous system. And I think with Qigong, it's tremendous for creating that balance within that autonomic nervous system because of the movement and the breath. And I can speak more about the Qigong because we have a synchronized movement that goes with the breath. And it's quite simple, really, because there's some very simple movements that you can do that can really bring people into it. It's quite accessible. And I remember nursing when I was had patients I was doing community nursing, and an elderly patient of mine said, "Well, what can I do? What secrets can you tell me? What can you, what can I do?" And I said, "Simple: move and breathe." And you go, "Well, move and breathe." Yeah, open the window, get off the sofa, and move and breathe. And just teaching him something very simple, like just opening his arms as he breathed in, and then closing his arms down as he breathed out. And you think I just told him this sort of ancient secret that had been kept from everyone. Just simply that. And that's a very basic Qigong movement is is moving the breath with the arms opening and closing. And that's what I love about Qigong, is it can be very simple, it's very accessible, and it's very easy to learn. So, is that my time up?
Well, no, I think there's plenty more to come over the coming years.
Yeah. Yeah.
So I think it's very informative.
I was waiting for you to stop me. That's okay.
Well, that's good, because there's a question probably in a few people's minds.
Sure.
Why is this man with an Australian accent living in Austria? And had I made a mistake? So
actually, I'm actually now in the UK. I kind of switched. I have two places, and I'm actually in the UK now. But I've lived over here for 25 years.
Don't let Mr. Steimer know. Anyway, what I would like to do now, if I may, is before Bill comes on, because I think this is a very relative element to what Bill's going to be talking about. And when I'm coming through from my little chat over to Bill, is that I'm going to invite Frank back, because I cut him short at the early stages, thinking about clinging to time. But I'm going to just recap on a little point I made, which is we're working very closely with the Chartered Institute for the Management of Sports and Physical Activities. Colin Huffin is unfortunately unavailable, but he did send me very kindly some nice words, and he said, things to make the group aware of. How about that? SimSpa, which is the shortened version, in collaboration with me, Mark Peters, who's been a very good presenter on this Healing Earth program, and an organization I no longer represent, which is the Tai Chi Union, have developed professional standards for Tai Chi and Qigong practitioners. I would emphasize this is for health and well-being instructors, not for martial artists, all right? And of course, to have Tai Chi and Qigong health and well-being approved by the Department of Health and Social Care. These standards now allow us to provide endorsement for education providers delivering Tai Chi and Qigong training. I've scribbled alongside it definitions and grading of systems and areas of immediate benefit, such as falls prevention and cardiac recovery. It also allows us to provide Tai Chi and Qigong instructors with professional recognition. There's a lot of discussions about professional recognition. My question is, should Tai Chi and Qigong health and well-being be a profession? And my answer to myself is always yes. It fits in with every other industry. This will be provided by SimSpa. We have a profession that we're very proud of, but we don't see it that way. We give away too many free sessions. I was just speaking to a local electrician. He pays £700 or £800 a year to continue into edition 17 or 18. Why should we not be the same? So, in following on from that, Colin says, the education partners and individuals we professionally recognise can benefit from the relationship with their professional body, i.e. SimSpa. The strategic intent of SimSpa can be seen through our recently published strategy. That strategy is quite informative, but very in-depth. Some of the key deliverables of the strategy have been explained through a series of blogs, I nearly said blogs, from senior leaders at SimSpa. This one may be of interest to this group from Tara, who is the chief executive of SimSpa. It focuses on closer working relationships within the health and social care activities. What we started off with, how do we collaborate? How do we work together? How do we address the benefits from the Chinese cultures and the Indian cultures? And again, I thank Healing Our Earth for letting me be part of this team. So he says, hope it goes well, and he will speak soon. And Mark, Colin and I are having a Zoom meeting on the 18th of September to discuss where it goes. What we do know is that it's likely that SimSpa will become the one major organization with the registers for all approved physical activity teachers throughout the UK. A major step forward, right? I'm now going to introduce a very, very good friend of mine. Oh, thank you very much. That was clever. I didn't touch anything. I think, Julie, you must have something to do with that. Shaping a recognised, valued and inclusive sport and physical activity sector that everyone can be part of. They have backing from the government and also Sports England. So I'm going to go over to a very good friend of mine whose books are here on the shelf, starting with An Idiot's Guide to Tai Chi, moving on to nearly 25 years, and you know that we had a very successful session recognising the work of Bill and Angela on their 25th anniversary of World Tai Chi Day. But now we're joining the big boys, the really big boys. Bill is already there. Please, Bill, I'm going to give you as much time as you want. And Sharon comes on about 5:30, and we've got time to spend on some questions and answers. And I'm going to, after a few minutes, invite Frank, he calls himself Frank LeBlanc, the white man. I don't know why, but Frank Ferrer is his name, and I'm sure he's going to come up with a very good question for you a little while later. Over to you, Mr. Douglas.
Thank you, Keith. Thanks so much for all the work that you do. And I just want to thank everybody here. This program has been just really fascinating, very exciting. And I thought what I would do, I wanted to talk about the Global Transformation Project. It looks like Siobhan just put the website up in the chat, so everybody has the website. And what I thought I'd do is I'd start with the vision and then explain why it's really a critical thing to happen at this time in human history. And then the other thing is how. And so the vision of the Global Transformation Project is, just this morning, we've seen this incredible wisdom being shared by people who have practiced and experienced the benefits, the transformative benefits of mind body. And you can tell by the way people talk that they're experiencing those benefits. So they're not just talking about it intellectually. And that's one of the things that I found from 35 years of working in major healthcare systems, is that the doctors that prescribe mind-body practices are the doctors who have experienced mind-body themselves. The ones who haven't experienced it themselves, they don't promote it because they have virtually zero education in mind-body science. And I've taught through University of Kansas Health System for their family medicine interns. They had no information about mind-body. All the health education is pharmaceutical driven. And so the vision of the Global Transformation Project is a United Nations resolution advocating mind-body, non-binding, so it wouldn't, nobody would be forced to do it, no student, no school, no country, but it would be a recommendation to educators worldwide to be aware of the profound science on mind-body practices. So what we're talking about in the Global Transformation Project proclamation draft is Tai Chi, Qigong, yoga, meditation, and mindfulness, because all these have a mountain of information behind them. And so the goal is to get this United Nations resolution. And what it is to create a situation where educators around the planet will be inviting people like the incredible people, for example, that we had on this morning, into the public education system for a daily mind-body education program. And so, before I jump into how all this can happen, because it's all very tangible and possible, but I want to just, yeah, there's the Global Transformation Project website. I want to get into why. And so just give you a couple of things on them. Oh, that's good. So I wanted to get into why. We all know, everybody here knows that there's something just way off with our healthcare system, because at this point, with the science that is known, mind body should be at the top of every prescription pad. There should be no doctor in the world that doesn't write mind body practice right at the top of a prescription pad. And then if they need some pharmaceutical intervention, then that would go below that. And so the patient would be engaged in mind body practices and education. And then the pharmaceutical would be a temporary situation to get them back to normalcy instead of a lifetime sentence like it is. And so what we know, Dr. Herbert Benson at Harvard, he wrote the relaxation response, which everybody, a lot of you have probably read it, but anybody who hasn't, read the relaxation response. He was the first medical scientist to put the science on mind-body practices together. And I'm talking about Tai Chi, Qigong, yoga, meditation, mindfulness, repetitive prayer also showed alpha state production, taking you into that meditative state. And what his analysis determined was that somewhere between 60 and 90% of the health issues that were sending people to their doctors were caused by stress and best treated or prevented by mind-body practices. 60 to 90%. Now, Kaiser Permanente did a 20-year study, and they found that somewhere between 70 and 85% of the health issues sending people to their doctors were caused by stress. Now, as far as getting mind-body practices into the public education system, it's a real natural thing, because what the scientists have explained to us, we have a monthly program at the Global Transformation Project on YouTube channel. And the scientists explained to us that children are in a alpha state, a meditative state, quite most of the time, up to about age 7. So up to about age 7, that's when we're healing the fastest, and that's when we're learning at incredible rates. And then everything slows down when we start to go more into beta brainwaves, with all the school and rules and all the things that and so we lose touch with that ability to touch into alpha state, and we lose that ability for rapid healing and rapid learning. And so it's a real natural thing for children to be in alpha state. So mind-body programs could be taught at age-appropriate ways. Yoga for children, Qigong for children, Tai Chi for children. And we've taught it education at all levels, so we know it's possible. And then as they progress through the 12th grade, then it gets more sophisticated. So some of the presenters today would probably be talking to high school students about the concepts that they were talking about. But there's many teachers, and some of you are probably here today and watching, who are familiar with teaching children and know that you can teach these things in age-appropriate ways. So again, on the why, let's just take a little example of the pandemic and the global lockdowns that had wreaked havoc on society on so many levels, destroyed 500 million businesses around the world. So what the data shows on COVID is that the frontline healthcare workers who had high T cell counts, they were much less likely to contract COVID, and if they did, their symptoms were much less severe. Now, their counterparts who had low T cell counts, much more likely to catch COVID, much more likely to suffer from the consequences of it. There was a UCLA study, and there's been other studies, but there was a UCLA study particularly on Tai Chi. But you can find these things on yoga, meditation, mindfulness, self-hypnosis, where when people practice these things. But anyway, in the Tai Chi study at UCLA, they had a control group and they had a Tai Chi group. And they were looking at their T cell counts because they were looking at how the shingles virus was affecting their immune system. And what they found was that the Tai Chi group boosted their T cell count by 50%. Now, there was a European study that showed that the Tai Chi group boosted it by 100%. So somewhere between 50 and 100% boosting of T cell count by teaching people mind-body. Now, I know we had photos in our World Tai Chi Day newsletter of hospitals in China and Russia during the pandemic, and in their COVID wards, they had Tai Chi teachers teaching the patients in the ward Tai Chi, getting them to get up and move and breathe. And so just that one thing, if you just took that one thing, we could be boosting the T cell count of public education students all over the planet on a massive level. And so there's a consensus building, and what we know is that, you know, those of us who've looked into the science, and I've immersed myself in it, you know, talking to scientists, and I wrote a book called The Gospel of Science, Mind-Blowing New Science on Ancient Truths to Heal Our Stressed Lives and Planet, and it's in 2nd edition, and it's 700 pages of collected science on consciousness, mind, body, and what it'll do for us. And when you look at that science, it's obvious that Tai Chi, Qigong, yoga, meditation, mindfulness, these practices are the most incredible high science that benefits us on so many levels, treats the overwhelming, which would prevent and treat the overwhelming majority of illnesses at a much reduced cost from this pharmaceutical driven healthcare system that we have. Now, I've been, like I said, I've been in major health situations teaching mind-body practices for 35 years. And when I first started, the very first class that we had was at a hospital called Shawnee Mission Medical Center. And back then, you know, back in those days, it was, you know, Tai Chi and Qigong, they were kind of weird things. You know, they weren't commonly known as they are today. And so a lot of doctors enrolled in the class. I just had a curiosity to see what we were doing in there. And what happened was, in this 8-week session, it was a combination of, you know, just breathing, visualization, gentle movement, and then I was teaching them a Tai Chi form as well. And after 8 weeks of this, these doctors were having amazing benefits. They were getting off hypertension meds. There was a surgeon who had chronic pain, limited mobility issue from a whiplash injury. And she'd been through all Western therapies. But after 8 weeks of this program, she got full mobility, no more chronic pain. I mean, it was blowing their minds. And in fact, 2 of the doctors forced their general practitioner to write them a prescription for the Tai Chi meditation class, so that they could submit it to their insurance company, because it had cured their hypertension in both cases. And so 35 years ago, me and these doctors in this room were very excited, because we saw this new epic for healthcare in America. Well, it's still not here 35 years later. And it's not because the science isn't conclusive. It's not because this stuff couldn't change the planet, not only health-wise, but socially. I've taught in prisons. We could be emptying our prisons. We could be saving trillions of dollars every year. This is all factual. It's all in the Gospel of Science. And so we could be transforming this planet by simply advocating mind-body education for public education worldwide. So it'd be a combination of physical education, yoga, Tai Chi. They provide cardiovascular benefits as well as the meditative benefits. But then it would also be a health education, a mind-body education class. We're advocating 1 hour a day. It could replace a PE class, and with, you know, much better results. And but, you know, I mean, different schools can do it in different ways. They can do it for short periods. They can do it whatever. We're advocating 1 hour a day. And then people can do what they want to with it. But okay, so now on the how, people think, okay, well, this is all pie in the sky, a United Nations resolution to get mind-body education and to get brilliant teachers like the teachers who've been talking this morning into the public school systems, into their local public school systems. It's not pie in the sky at all, because in 2014, the United Nations General Assembly voted to create the International Day of Yoga to increase global health and global harmony. And that's exactly the reason for the Global Transformation Project resolution to advocate mind-body education and public education resolution for the United Nations. Now, what's interesting about this International Day of Yoga that was created in 2014 was that it was voted in by the General Assembly with a record number of co-sponsoring nations. 177 co-sponsoring nations voted to create this International Day of Yoga for the same purposes as the Global Transformation Project, to get it into public schools. So this is possible. The world is ready for something like this. And if we could get a proclamation, then every educator in the UK or the United States or whatever who understands the benefits of mind-body could go to their school board or go to their administrative planning meeting with the United Nations resolution pointing to the science, the overwhelming science. Now for education, we've talked about all these health benefits and cost savings and tremendous savings for society economically, but what does it do for the student in public education? The science shows that it increases IQs dramatically. People that practice mind-body practice on a regular basis, we all know this, that practice it, our IQs improve, we become smarter, we become more solution-oriented. Our GRE reading scores improve, math proficiency skills improve, verbal fluency improves, social interactions between students, bullying goes down. All these things are the things that schools and parents and students desperately need to be expanded in public education. And so it just makes sense on so many levels and it can be done. So what I'll close with is one thing. Oftentimes I get introduced to talk about the Global Transformation Project as Bill's Global Transformation Project. Well, I came up with the idea because I'd been immersed in all this science and it was just pushed in my face that it's really irrational that the world has not already done this a long, long time ago. But the thing about it is at the globaltransformationproject.org, there's a petition that you can sign. And also, if you're an educator or a mind-body educator and you're involved, there's other ways that you can get involved, but you can sign the petition and you can ask other people to sign the petition. As long as this is viewed as Bill Douglas's Global Transformation Project, you can forget about it. It's never going to happen. World Tai Chi Day never would have happened because Bill and Angela Douglas did Tai Chi in Kansas City by themselves. It just, these global movements that have huge impacts around the planet, they're not a person, they're a whole bunch of people realizing that something's out of whack and something needs to change in a huge way. And this would change things in a huge way. So when there's programs like this program, and I'm not here, and people are talking about the Global Transformation Project, have you signed the petition? Have you looked at all that science? It's really amazing. When that happens, the Global Transformation Project will happen because we're not going to put all the work. We're going to contact every United Nations mission on the planet, but we're not going to put in all that work until we have at least 100,000 signatures. And with all the people that understand what mind-body can do for us and know that it would do it for the planet as well, we should easily have millions of signatures to take to these United Nations missions, and then we can make this happen. This can really happen. It's not pie in the sky, but it's got to happen without Bill Douglas being here. There has to be programs like this going on week after week after week after week when you guys get together that say, oh yeah, have you guys talked about the Global Transformation Project and signed the petition and told people about it? Because that's the only way that it's going to happen. It's all the science shows that when we become we instead of me and you, that's when huge things happen. This is all scientifically validated because the International Day of Yoga and World Tai Chi Day, when people do these mind-body practices together all over the planet, the Princeton Engineering Director of Research, Dr. Roger Nelson, who's the director of the Global Consciousness Project, he showed that when we come together in connection and healing and compassion, that we actually change the global consciousness. And so we have the data on that. It's in the Gospel Science book, shows how the International Day of Yoga increased coherence and global consciousness in that 24 hours. And World Tai Chi Day did the same thing. And so, and that's another aspect of this. By expanding the number of people around the planet in public education who are going into alpha state on a daily basis, that's going to have a huge positive impact on the global consciousness. And the data shows that this will help reduce crime and conflict in cities all over the world. This isn't like spiritual platitudes. This is hard. This is hard science. And so we are the first generation to have all this science. And we're in a position where we can change the future of humanity if we can come together and make this thing happen together. globaltransformationproject.org.
Bill, once again, we hold our hands up in admiration for the work you, Angela, and others have done. And I'm pleased to see that Siobhan is actually promoting some stuff on the pages here. But before I ask Frank to say a few words, is that I don't know, this is a book. You can't see it, I don't think, but I was at an event in Scotland in 2006, And I was sitting having lunch with the late Dan Doherty, who used to be chairman of the Tai Chi Union and a well-known world martial artist. And he was having lunch with a lady friend who was called Dr. Luce Condamine, French. And she produced this book, Tai Chi for Infants. To Keith, good luck with children and Tai Chi. Happy Chi. Luce. All right. This is a lovely pictorial book which will enhance the Global Transformation Project for education. I'm now going to ask Frank to start off a little bit of a question and answer program because I rudely interrupted him at the end of his little chat. And being Welsh, I was amazed that he didn't say, watch it, mate. Over to you, Frank.
Not at all, Keith. I'm used to you interrupting me, so it doesn't bother me anymore. Hi, Bill. Good to see you.
Hi, good to see you too.
I'm sorry I wasn't able to make it to come to the celebration. Unfortunately, I wasn't well that time, but it's good to be here. I agree with a lot of what we're saying about the making it happen from the basis. But when you talk to some of the people I talk to, and you say, you say about, there's a lot of science behind it. And then when they say, I speak to a lot of teachers because I do quite a lot of work, not within my Tai Chi world, but within my other business, what I do for work. And I'm now going back to go and teach them some Qigong, so that's some good thing. But they say to me, well, what science is it? So I said, well, this is physics. This is the work of people like Niels Bohr and people of that sort. So this tells you what this is all about. This is all about vibration and just simple things, as we've learned, with just breathing, opening your hand and closing your hand is enough to get people to experience this. And the more that we can do that, and like you're saying, the more we can spread that globally, we'll make that happen. And what I wanted to say was, we just need to explain, just keep going, how simple it really is.
Yeah. One thing I wanted to throw out there is at globaltransformationproject.org, we have a lot of the science that I've been talking about immunity and educational science, all the kind of stuff that you need to show people so that they would realize, oh yeah, this makes absolute sense that we should do this. But if you go to globaltransformationproject.org, you'll see a tab on the science. And then you also see a tab that shows that this is already happening in schools all over the planet. So it's like the template's already there. And and all of us can learn how to teach kids, because I wasn't trained to teach kids when I started learning how to do Tai Chi and Qigong. I just figured out how to do it. You figure it out when you start doing it. And so yeah, it's very exciting. Thank you, Frank.
Thanks, Frank. I think also, Bill, is that when you look at the older generation, I've just qualified for being in the older generation. And I think that we have in the UK 12.5 million people, 20% of the population over 65. And I was talking to somebody in the States a few days ago, and I said, do you realize that you have a major marketing opportunity to convince over 65s in the USA the importance of Tai Chi, Qigong, yoga, and as you say, meditation, Ayurveda? 65 million over 65s in the USA.
Yeah.
What a marketing opportunity. What a marketing opportunity.
Keith, one of the things, and I'm sure everybody here who teaches seniors like I do, because I have a lot of classes, hospital classes that are, seniors and older people. And one of the things that you hear echoed again and again and again is when these people experience this for the first time because they had a health issue that drove them to it, inevitably you'll hear so many of them say, God, I wished I would have learned this when I was younger. And we have the ability to make that happen. Like I said, we're the first generation in history to have this science, and we're the first generation in history to have a global mind-body community building, like the work that you're doing, Keith, with Healing Our Earth, bringing yoga and Tai Chi together and Qigong together. we underestimate where we are as a global mind-body community. And if we can come together around something, like this petition for a global transformation project, we could literally change the future of the planet. And then there wouldn't be kids in our senior classes going, geez, I wish I would have learned this when I was younger, because they would have all learned it when they were younger.
The importance of having influencers is growing. We have so many professional sportsmen that do some form of meditation before they start.
Yeah, the quarterback who won the NCAA, that's the big college university football championship in the United States.
Yep.
He's a meditator, and he sits in the end zone and he meditates before every game, because he said he wants kids to see him meditating. Yeah.
I think
we have a link to that on globaltransformationproject.org. Yeah.
Yeah, seen that, and I think that it's those type of influencers that will help us immensely, because some of us who have worked from, shall we say, a shop floor level, do not have the right connections at the top level of influencers. And I've got a few thoughts on that, but I'm going to come to a session now where, Bill, I think we've spent a nice little bit of time on the Global Transformation Project. I have two observations, if I may, to be so bold, is that I broke it down the other day into two elements. One, I'm sure you've already considered, is we're looking at the UN as an activity on the project chart. And the other one is the education. And from my perspective, I might have some practical opportunities to influence the education, but not necessarily the UN. So we need some other people to back Bill at the highest level of politics. Kamala or somebody, I don't know who's going to be, but we're in a situation where we now need to actually say anything. And if there's anybody else with a comment before we introduce Sharon.
Well, one thing I can say real quick is that if we get a massive number of signatures on the petition, that'll carry a lot of weight. So don't underestimate our value as individual people to spread the word on this. But we do need celebrities as well. But don't underestimate the power of you spreading the petition.
I'm sure Joe in Florida will spread it across the whole of the state.
That would be great.
Okay, and now we move on to.
It's time for us to see how we can go from here. And just before we introduce Sharon, well done to all the speakers. Wonderful contribution to from everybody in a different format. Everybody is doing their own bits. And yes, if we take the example of the yoga, which actually we started in 2006, although 2014, the United Nations actually accepted, the main Swami came to London in 2006, and that's when the ball started rolling. But more important, everybody has agreed that now we can transform the healthcare. It just doesn't have to be focused with just the mainstream. All of you have got so much wonderful things to give, so much beautiful input. So we'll carry on, like in Healing Our Earth, we'll keep on mixing different cultures and nationality. And we go to Sharon just for a moment. We wanted a bit of mini session from Austria, but he just had to shoot off. So Sharon, a global namaste, who is a senior host at Healing Our Earth and a producer for the last half hour, and welcome Amrita, who is the senior anchor at Healing Our Earth in Punjab. And we want to ask everybody same questions so we get answer to how we move forward. Before we do that, Sharon, welcome, and Amrita, welcome. Your views for transforming healthcare and the Global Transformation Project. Sharon, unmute yourself so you can speak, and then we want to ask questions to everybody.
Well, I thought I was coming on today to really speak about Qigong and my experience of it. But as a person who worked in the schools for years in the arts, to me, the Global Transformation Project is it would be an extraordinary gift to the world. And I've noticed since Robert Kennedy came out and really spoke about the depth of the problems in healthcare in this country, that there has been a shift for the people who listen to him. It has been, for me, I mean, I'm very aware of the issues, but he brought, I highly recommend that everyone find at least the last 20 minutes of his speech when he described that he was suspending his campaign, because he gave the most powerful talk about the issues that are facing us. And he and the people, Nicole Shanahan and the people with him, are really, really, this is their main concern. This is why they're putting themselves out there. They're very brave in this world right now. And I admire it. And I've noticed that the alternative media now in the US is picking up on that. More and more of these alternative people on like YouTube, et cetera, are now really talking about the deep, deep issues. I had no idea that 50% of children in this country were obese. I didn't know that. I knew there were problems. So coming to Qigong to make my film and practice, coming that way after years of ballet, modern dance, Middle Eastern dance, and then living with Sitara Devi, learning Kathak dance in India, doing yoga, to find Qigong has been so profound for me that I wish that I had had it when I was teaching in the schools. I know from doing that work and working with flow anyway, working with movement and, you know, turning into, we did a lot of like Ramayana, etc. You know, to have Qigong would have been incredible. So my heart, Bill, is completely with you. You know that. And in terms of what you're all saying about getting it out in the world, well, guess what? My film is finally going to be finished in a few months. And I made the film and have like 20 different masters. I hadn't met Bill then, I wish I had. But I brought it out to really show the beauty of Qigong, how it helps you on all these different levels. And the ancient science, as Bill talks about, that's inherent in traditional Chinese medicine. You know, and the same with Ayurveda. You know, we really have these traditions that are, to me, are scientific. You know, they're centuries old, and they need to be brought into, I know that if they were brought into the schools, that these children, and also particularly, you know, both of these traditions speak so well about diet, right? And those things need to be brought forth. And I pray, we should all pray, that this brave experience of Kennedy and Nicole Shanahan and those that see what needs to happen to help our children and help our seniors, help everybody. You know, I pray that this will really spread and people will wake up and start really taking care of themselves so they can live lives of joy. And I think that Qigong really brings, I mean, Daisy Lee, who's a wonderful Qigong teacher, she always talks about playing Qigong. And so it really is like playing and bringing just the sense of flow, of grace that it brings you, and awareness of your body and awareness of the chi and the prana is so profound that, you know, I've given years of my life to making this film and bringing it out, and hopefully it will help and it will wake up and excite people about really looking for Qigong. I know I'm actually glad it took this long, because in the meantime, since I brought Qigong to the Shift Network, and then I brought it here to Healing Our Earth, there has been a wider outreach about Qigong since, let's see, about I started about 6 years ago with the Shift Network. And now the Shift Network has become the Qigong network practically. So many people that I brought have been on there and more. So I'm very appreciative for the fact that it's come out to a wider audience, but we want it even wider. And we want it in the schools because I know how much it will help our children. Because it's not only the movement and the consciousness, it is also the healthcare.
Sharon, I just had this flash of school students sitting in a classroom seeing your film.
Oh, thank you. I'd love that.
I mean, that would be powerful.
I would love that.
Yeah, if anybody who hasn't seen the clips, this is an incredible film Sharon's created. Yeah, it's amazing.
Oh, thank you. And I'm very excited because I now have an interlude in there with the foremost Erhu. Erhu is this extraordinary, it's like a human voice instrument of Chinese tradition. And I have Jabing Chen, who is probably the foremost Erhu player in the world, playing with this piece that's from the Tao Te Ching. And it's about the way of nature and the relationship with nature and how to work with your mind and with what constitutes true leadership. And the Tao Te Ching has such amazing words about what it means to be a true leader. And that's really what we need in this world. True leaders who really care, truly care. It's not just a bunch of talk, but who truly care, like Bill does. And like probably, I'm sure all of you care about humanity and our future.
Sharon, you already have a video of the quantum chi that you've done earlier, not the new movie that you are doing. If you got it at hand, because it shows the flair of the movement of Tai Chi and Qigong, if it's there with you, maybe we show it to people now.
I have two trailers. I'll show you the first one, that's sort of more of an introduction into it.
Yes.
So I'd love to show it. If you would like me, I can do it now. Thank
If
you, Neil.
you keep it ready, meanwhile, we keep on talking. And Keith, shortly you will be going. So on behalf of Healing Our Earth, another well production done for your hour. But because you brought in so many people, then I just said, let's make it about hour and a half or 2 hours. And it's so nice that we are plugging. We had Wales, England, Austria, USA. I think Joe is here. I think you mentioned that he's from USA. So maybe we hear a comment from Joe. Joe, you can unmute yourself if you can hear us. And maybe if you give the blessing to Bill and Keith, and what do you think of it so far?
I think this is a wonderful endeavor. I really I didn't plan on speaking or saying anything. I'm a Tai Chi teacher, student. I've been involved in Tai Chi for well over 40 years. And I believe it's fantastic. That's why I teach it. So thank you for inviting me. And that's all I have to say. Thank you.
So Joe, you're welcome at Healing Our Earth. You're part of the family now. You can see how passionate and emotional William is about, and it's actually going in line with Healing Our Earth, where we say we need to start with the children. Anything we do, if we start with the children now, we may be able to stop the rot that we are following into, not just climate control, but mentally and physically. Like Sharon said, she was not aware that America, half of the children are now obese, and soon clinically they will be obese. That goes for United Kingdom, Europe, some part of Africa. Those which are not malnourished, they are okay, but the other ones at the other end are like that. So Joe, just stay around. Let's watch if Sharon has got the video ready, so we get a glimpse of what she's planning. And
if I may, Neil.
Yes.
Just a very quick thank you to everybody. And yes, I've taught in schools. No real formality on it, but I think that we're moving in the right direction. And just to let Bill know is that I'm having a further conversation with Roger to try and understand some of the difficulties and the ways forward. That's with Roger Yanker. And then we'll have something to present to you to support your activities. And thanks again to everybody who's participated prior to our little session. And good luck to everybody. Namaste, and over to Sharon to show her marvelous films. Thank you very much.
Keith, before Sharon starts, Keith, you also mentioned the over 65s or over 70s or over 80s now, which are also very important. So I think not just the children, but the education should be spared and shared in the care homes and in the elderly homes as well, so they can actually sustain and live better.
Well, I was going to start a small group. I think that the over 80s are quite a small number and form a minority group. So I asked a couple of people and they said, actually, to start a group, you need to design a flag and start a protest. And with that, I bid you good evening and good morning from everybody in the States. Thank you very much for your time. Bye.
Thank you, Keith. Okay, Sharon.
Thank you, Keith.
Go ahead.
Qi is a foundation of many healing arts. Qi is foundation of many traditions in China. Life is from energy. Life is from qi. And how about qi? Where does the qi come from? From love. From love of the universe.
What does qi feel like? A buzz, tingling. You're so excited, full of energy that you want to be playful all the time.
When the qi flowing, you can feel like warm, expand, some tingling. Because qi, when you move, it also have a power to heal.
When you're doing Qigong, what you're doing is cultivating life force within your body. You become a conduit for information, for new information to come into the body. And you connect to the Qi of the earth and the sky. You're simply a conduit.
In Taoist practice, you're harnessing this light, this energy, this qi. And so when we cultivate that energy from within, that compassion, that joy, that love, we can shift our state, shift that emotional state into something that's elevated and not constricted.
Learn to shift from externally focused, searching for happiness, searching for meaning of life. You go inwardly, recognizing you have more access to life inside of you.
It's a discipline, a healing art, a way of training the body and mind, a meditation in motion, a medication in motion, a way of conditioning the body for martial arts, for sports, improving strength, stamina, balance, and coordination.
Yoga practitioners and teachers love Qigong. The Qi focus turns their attention to a much more awakened internal sensory awareness.
There's a sense of resting in a very natural, open, spacious, clear, luminous energy, which then carries you spontaneously and creatively through the movements and the flow.
Therein lies the ability of practicing Qigong to build up incredible force in the body for rejuvenation, longevity, self-healing, and healing others.
Qigong for everyone.
Qi is love.
Qi is light.
Qi is free. Qi is energy.
Beautiful. So we got a glimpse of it. Wendy, you wanted to see what it would look like, and you saw a glimpse of it. What did you think of it?
I was about to make a comment. The first word that came to my mind was beautiful as well. It was beautifully filmed. I hope that, I mean, I think that's going to create a lot of people thinking intrigue, perhaps, if lots of people are not so familiar with what is Tai Chi Qigong. Oh, and yeah, I mean, perhaps, I don't know, I always make one comment that with because I actually was very guilty of that and not making that distinction, is that Tai Chi Qigong is still a martial art. I don't know how that feels.
Wait. I have another trailer.
Oh.
I have another trailer that goes into the relationship between Qigong, Tai Chi, and Wushu. Okay. And how Qigong is to me, and to the people I've spoken to, it's the foundational practice. It's the healing practice. It's a self-awareness practice that should be, along with meditation, that should be practiced by any martial artists. And so, yes, that's one of the trailers that talks about part of it. There's another one that talks about that. And then there's the whole movie, of course.
So shortly, we'll see the second part. Let's take comment from Wales, from Frank, and then we move to Julie, and then we ask Bill what they think of it so far. So Frank, up there in Wales, what did you think of it?
I think that's what I need to keep stuck on my phone for every time that someone says to me, "What does chi mean?" You just think you've encapsulated everything that we wanted to show in that short bit. That's enough for me to say when people say, "Oh, what does it do?" Well, it's this. No, you can say it is everything, but people wanted to give it like a short little bit of what it is, and that just shows what it is.
And
thank
Frank,
you. That's
not only was it educational and short and succinct, but the background soothing music, the voice over, because that attracts you and sucks you into listening that. And this is the whole point of bringing educational materials. You need to have good vision, the voice parapsychology, attract the people. Once they are drawn into it, their mind is ready to listen and see. So Sharon, well done. Let's go to Julie. Julie, you earlier were interested in integrated because you yourself, when you met the first speaker in Ayurveda session in the first hour, and to now in this last hour, you've been here the whole episode. What did you feel about what Sharon shared as a first mini clip of what is going to come?
Absolutely beautiful. The scenery, the music, but the movements, I wanted to move, but I could feel the energy moving in me. And when I saw you at the end on the road and the movements, it was, well, I could feel my actual energy in my body shifting. And it is that, if it can have that effect on somebody who doesn't know anything about Tai Chi, and I do know about energy and Qigong, but to have a physiological reaction to just watching that clip, I think you've created something very, very powerful. I think it will attract so many people and make them think. It's beautiful. Thank you.
That's my mission. That's from the time I encountered it. I was really taken with the depth of the information. It was like, I have such a deep background in India. So it was just like a compliment, a total compliment. And this brings up, what Bill is always talking about. All of these things, all of these ancient traditions that have been studied for centuries. And it's time to bring them all together to heal our world, heal our earth, heal ourselves.
And Sharon, Julie is from the hypnotherapy world and she likes bringing that. So that's why she was able to associate what was happening as an alternative to what she saw. So it was an unbiased view from somebody from outside, but within the circle of hypnotherapy, meditation, yoga, Tai Chi, Qigong. Let's go to our senior anchor, Amrita, who is there in Punjab in India. She has obviously seen many of your videos. Amrita, this new mini version that you saw, and we've seen plenty from Sharon because she's our regular producer. What do you feel? What did you feel? What energy you felt there in India?
First of all, global namaste to everyone. And as always, the fragrance of this rose is always there with me. And the beautiful part, which I have always felt, which is also important, which in fact William has been talking about, is the connection of knowing and understanding that all the traditional systems of healing worldwide have been talking about one basic thing, which is the chi. And this is one of the very important sources. And that's why when Wendy was talking about a martial art, an art being a martial art, you can only accomplish anything physically when your internal energy is very, very strong. And that's what the chi is doing. And that's what the prana is doing. And that's what the life force within us is doing. And that life force has plenty of things to do with your mental, physical, physiological, psychological aspects in terms of your personality development, whether we talk about children in terms of rejuvenation, whether we talk about aged people, or in terms of an individual who has his own life to stay healthy and make right decisions in life. Secondly, I also found, Sharon, the video was not just talking about, though it was really beautiful, fascinating, but it was also talking about contemplation within oneself. And that field of contemplation comes from many art forms, many of the things where you meditate and you go inward, in that you don't have to sit anywhere. You don't have to be at one place. Your belief in a particular thing, your way of adapting, whether you adapt any of the traditional medicine systems and you work on them, all will give you a right path towards self-contemplation. And that will trigger up many things which will harness an individual. And I think these kind of things, I'm very much into, with the same belief that yes, these kind of things should be integrated in children from the very beginning, because that's where the road is starting. And that's where the way will lead towards healing our earth. Thank you.
Beautifully said, summarized, Amrita. So that was nice to have a different opinion. It's nice to get different opinion for same thing that we are seeing. Yeah. Sharon, keep the next part ready. We're going to move to an NHS retired surgeon here. He's an orthopedic and a spinal surgeon. Maybe perfect for next week's episode, which is body and joint X and chiropractic and spine and to do with it. Ankul, global namaste and welcome to Healing Our Earth.
Namaste. Thank you very, very much. Very nice.
And what did you feel?
I'm really delighted to have met these people, because I have got exactly the same thoughts as you all, because it does not take long in your surgical career to realize that you have serious limitations. There was a time you feel that everything can be done with the help of a knife, but it is not possible. And it soon you realize that you have much more to look into. So I have some very simple comments. First of all, thank you for all your very, very important information. And there are a few things that I would like to say is that when it comes to providing information to people, and when it comes to convincing people as to what is necessary, the first thing that you recognize is mind is not recognized as a central locale in your body. That's a tragedy. It is not a physical, that's the fundamental problem with our particular way of thinking. And when it comes to seeing my patients, I usually take all the chronic and complicated cases, because I've had my training in general surgery first, then orthopedics, then spinal surgery, and I do endoscopic spinal surgery. And at the same time, I've done my acupuncture training. I'm talking of nearly 35 years ago. Then I use every possible person to take the help for managing chronic back pain in particular. But in the process of trying to get hold of NHS patients and try to see them, I did my what you call medical law as well. So one of the things I found was that people, it's a conveyor belt system within the NHS. You come and get on and work and finish off with this. But my major project work for the Masters in Law was decline in the quality of care simply because we work in silos. And we all work very differently, which is not a good way of giving proper health care to anybody. So that is why I was very delighted to see all the people giving this kind of information. But what is interesting is I work for the court a lot, and they provide all the time is evidence that what has really worked on, what has not worked well, and therefore the importance of collecting the right type of evidence. Now, my biggest problem with the evidence collection is when it comes to mind-body connection, it may not be that easy to provide the evidence because in a conventional scientific way, it is a very different way of providing evidence as opposed to when you take everything in a very, very global way. The holistic method is not that simple, but many people don't get it. And at the same time, many people's egos are hurt. So I often try to do it in my own way. I'm very much into Vedanta study. I'm the chairman of the Indian Metaphysical Society. So I've been doing this particular work, but all that I realize that I'm in the pre-primary class in almost all subjects. So I think I will certainly need all your help because I'm trying to do the same thing because I'm very much into healthcare economics as well because I did my MBA studies in health education economics. So one of the things that I would require to know from you is how we can integrate the care in such a way, particularly take care of the social services and healthcare projects, so that we get to know that between the person leaving the house and again coming back, how much have we made a change in the quality of life by the various interventions within the hospitals and outside the hospitals. So you'll be quite surprised the amount of money we spend for things which are squandered away for what do you call our management problems and other issues. And there are some of the issues I think we should be able to tell the NHS that I think we need to cut these things down and we can take the help and do it on the outside. I hope I don't want to keep ranting on this, but thank you very, very much. I would like to communicate with somebody so that I can integrate and get in connection with all of you all.
Thank you, Anukul. Amrita and Vaishali, our communications will be in touch with you. You will also be connected to me. I will guide you how we move forward from here and put you through to a different group. And
Absolutely.
we will also keep in touch with Bill and Sharon through some different groups that we have got. And your input is very good. And as you say, NHS have started maybe listening to people. Rajiv from NHS actually said that for pregnancy, yoga and Pilates are now also started being included. So let's move on together. Let's transform the healthcare through different projects. So it'll be very nice and we will connect with you. Sharon, are you ready for the next round of video? So let's show it to people and then we can have more comments. We'll have a comment from Joe. William, you have got to make a comment because you, of course, know about Sharon. Sharon was the one who first brought you on Healing Our Earth. So it'll be nice. So Sharon, as in when you are ready, just click on and it'll be nice to get to everybody's comment. So let's look at the second one. Here it comes.
Martial art include all the combative arts like karate, judo, Chinese kung fu or Chinese boxing. It's a combative form of fighting, the art of expressing the human body.
Kung Fu, it means time and effort together is Kung Fu. The muscle power, the right position, the right spirit. More than that, is the internal qi, like a battery.
The beauty of these qi cultivation practices is that you can enter in anywhere. The qi in qigong is obvious because it says qi work. With tai chi and kung fu, it's still qi work, it's just called something else.
Qigong, qi skill, is the energetic core of Tai Chi Chuan and Wushu. The skill of delivering power in a punch is not that different from what is required to move qi within the body for self-healing.
When you exhaust your qi from doing fast physical activity, as one might in martial arts, you need the qigong to bring everything down, to settle the energy, to come back into repair mode.
So through practice, you feel in your heart and your whole body full of love, full of qi.
All of the history of the martial arts, it came out of the need to protect oneself, to protect your property, your family from being abused by someone else who was overpowering your forces.
If it's a threat of someone harming you, the best thing is to try to avoid it. But if your life is at threat, you need to know how to save your life. There is a physical protection, there's a mental protection, and there's a spiritual protection.
Most of us in modern life don't have aggressors attacking us. Most of our martial battles are emotional, are against stress, finances, money, our own internal voices in our heads. So how do we stay protected against those attacks?
The best way to protect yourself in a martial situation is to have mastered relaxation and presence. Then it's very difficult for somebody to harm you.
To be a quantum warrior or warrior of the Tao, we have to be brave enough to enter into unknown parts of ourselves and to bring forth the places of power and the places of shadows that we can transform into light.
The essence of martial arts is not to be aggressive. It is to be secure in yourself so you don't have to accept the challenges of others.
Martial arts, Tai Chi, Qigong. When you start dealing with energy, you want to know, oh, can I hurt somebody? When you expand and grow in love, can I help somebody? Can I heal somebody?
Another beautiful production, Sharon. I thought it almost started with African drum beats of Masai Mara people, because that's exactly how they welcome and those drum beats. And of course, this episode is being transmitted on Sacred Mysteries YouTube channel, so you can go and watch it on there. You can go and watch it on Healing Our Earth, Gyan, Hindu Forums, GM, Simran. Sorry, it's on so many channels over here. So Sharon, well done. It's nice. Both were slightly contrast but complementary to each other. They were bringing different facets. So again, maybe we can take, but let's go to William here at the moment, because he also knows quite a few of them who actually appeared there. And Sharon, you brought at least more than 50% of them live on Healing Our Earth, including John Milton, Wai Ching. So many people have already been here. William, your thoughts on both the clips that you have seen, and I think now you've got the wider picture because you are from similar background. What did you think?
Yeah, well, I've been a huge fan of film my entire life, and what I've come to realize is the great cinematographers, Sharon is able to be an extremely effective documentarian. So she conveys really valuable information in her film. But what she does is what great cinematographers do, is they give you a multi-dimensional experience where I can actually feel, I can feel my mind when I watch her films kind of flowing in tides, and then the heart's involved as well. You know, the combination of the music and the flow and the color and the personalities, you know, the authenticity of the personalities that she's able to capture with the camera. And to, you know, select those parts, you know, in the editing process, it's a really breathtaking production that you've created. And I think it's going to be just a huge thing for mind-body practices in general, you know, permeating the planet. Because, you know, like I said, I had that vision of students looking at this. And one of the things that you're able to do with the film is you're able to just create, somebody said, I think, intriguing, this sense of intrigue where you're being informed and educated, but at the same time, you're sensing that there's something much larger to this that you are drawn to discover. It's like an invitation. Yeah, it's like this really beautiful, poetic, musical invitation into a world that's much larger, and children need. That's one of the things I've come to discover. I've started doing poetry readings recently, and most of the people, I'm the oldest person in there, always, and they don't know what to make of me at first, but then they start to get used to me. And the thing that I've realized is that, you know, young people, they're adrift. You know, the technology, the permeation of the technology in their lives, you know, it's off kilter. Things are off kilter, and it's very emotionally disturbing. A lot of kids are on pharmaceuticals, you know, ADHD, all this stuff, you know, all these diagnoses that they get, which really would be addressed by these mind-body practices. But I could see these kids sitting in a classroom watching this film and just having a yearning to understand more about this thing that you're talking about. So it's an incredible service that you created, Sharon. It's really beautiful.
Thank you, Bill. I'll just say it out here. I have this idea. I was talking with Doug, my editor, about this, that during the credits, it would be really nice to have you, because people have you talk about World Tai Chi Day, Qigong and Tai Chi Day, and show some clips of it, and even bring up the, because I'd love to have, you know, I can't re-edit, but I'd love to have you in that. So this was the idea that we came up. So we should talk about that, because it would be a very nice to see people all over the world doing it, but also to have you talking, you know, it had to be succinct, you know, just to get that message with this film would be beautiful.
Oh, I'd love to do that. Yeah. When we first started organizing World Tai Chi Day, we went to Hong Kong to meet with the Hong Kong Tai Chi Association, and they had a school like in the rooftop of a building, so you could go upstairs and be on the rooftop. And so we're standing outside in this Grand Canyon of skyscrapers in Hong Kong on their rooftop garden where they teach Tai Chi, and we were explaining the concept of a World Tai Chi Day. And they said, well, why would we want to do that? You know, we already do Tai Chi. And I said, yeah, but I said, how many students do you have here? You know, and they had like several hundred that would come in and out. And I said, okay, you got several hundred students here. Look around at these skyscrapers. You know, how many millions of people are surrounding us who could be profoundly benefiting from these things? But I'll bet you that a lot of those people look at Tai Chi and Qigong as something that old people do, because that's how Chinese kids are. A lot of Chinese kids have that feeling in Hong Kong, especially. And I said, you know, you should have like just endless droves of these people coming through, you know, to be learning all this stuff. And if they could see that the whole world is doing it, including young people, and that's one of the things that's so exciting about the World Tai Chi Day, is we get these videos of young people, you know, elementary school children doing Tai Chi long forms in India or different countries around the world, you know, Pakistan or whatever. And just that sense of communion and connection and realization that this is something that's real natural for the planet. And your film does that so beautifully.
Oh, thank you. Yeah.
Julie, you like the second. Julie, you like the second video? Or Julie, it's just cut off over
I
here.
love the second video because it gets into the whole concept of the martial arts aspect of Tai Chi and Qigong. And there's, and that's been a bit of friction in the Tai Chi and Qigong world, which I wasn't prepared for when I first started, becoming part of a global Tai Chi community. But yeah, it really addresses that because, really, when you go to the core of Qigong and Tai Chi, what you're doing is you're doing this high level physical, mental, emotional, energetic engineering process through your being that profoundly improves whatever you do. So if you're doing martial arts, your martial arts is going to be way better. But if you're built like the African, I believe it was the African teacher, said that, but if healing the planet is your thing, it can do that too.
So it's beautiful. We had a wonderful session today. We started with the Ayurveda integration, then we went into Pilates, we went into care, we went into Reiki, we brought a lot of Tai Chi Qigong people. And I think slowly and gradually, if we start mixing with each other, then maybe someday we can follow the World Yoga Day. We need a couple of countries or a stadium or something to sponsor and then show people the beautiful part of what is happening. And so well done to everybody. Bill, thank you. You've been here at least for 2 hours or more. You started earlier than your session. Sharon, wonderful. We want to have a few words from you as well. Amrita and Sharon, shall we tell them about our next couple of episodes so they know what to expect from us? And those who would like to participate, they can come and tell us more about it.
So future online episodes. What's coming next week is also interesting to heal our body, healthy life, heal thy life, body and joint aches. So all those who want to get a relief from the joint pains, as well as body aches, as well as arthritis and other kind of things, we are there with experts who will give profound solutions on that on 8th of September, 2024, 2 p.m. British Summer Time.
I do want to
And
say
the next week, yeah, Sharon.
I'm very excited about this show because
Yes, I know you're pretty excited about this show.
because I've had 2 hip
We have
replacements.
Dr. Anukul as well, who will be giving an expert advice to all your questions.
Yes, I have a lot
Yes.
to offer for this because I've been through 2 hip replacements as a dancer, and all of the different kinds of exercises and modalities that I've used, from not only physical, but psychological, emotional, to heal my hips, and they're wonderful. I welcome them in. And
Let's move
so much
further. Yes.
And Sharon, you're also bringing a guest over there on that one.
Yes, Maureen,
Again,
yes.
she's useful and she has got many things to share with us. So it's so wonderful that guest, Maureen, I believe it will be Maureen who will be joining you
Yes.
later. So that, and Anukul will be very useful because body and joint aches. So when we discuss with Dr. Lalit Soda, the senior anchor at Healing Our Earth, who is a chiropractor, a very famous chiropractor here in London and a lead for medical tourism for us. And we say neck, shoulder, and back. Now, almost everybody on the earth has some sort of backache, not because they are weak or there is any problem, because backache is very conditional on almost every human being, L1, L2, L3, L4, L5. Who better than Anukul, who is a spinal surgeon? So he can go maybe right from the spine into, starting from the neck down below, right up to the sacral chakra over there. So it'll be useful, Anukul. So Amrita and Vaishali will be in touch with you to allocate some 20-30 minute session, and you can just be like this. You will love meeting other experts at Healing Our Earth. And Amrita, going to the following week.
Yes, the following week, which is the 15th of September, again, we are bringing some beautiful women with Glow Women. This episode is exclusively talking about human values, and we are having this episode, which is for the women, by the women, and of the women. Today's women uniting for better tomorrow into 22nd century. So we look forward to this.
Yes,
The
and
wonderful episodes.
women are a very important part of society. We at Healing Our Earth believe that if you empower women, then you empower humanity. And it's simple as that. So we have a lot of women. More than 70% of our followers are women. So it's beautiful to have them. So it'll be very nice. And so, Bill, your concluding statement, then we go to Sharon, and then Amrita, you and Sharon can do a nice closing prayer. And we thank everybody who has been here.
Yeah, it's really, it was an extraordinary program. Yeah, I was really so glad to be here and hear what everybody had to say, and seeing everybody's experiences from different levels and different angles, but really all coming to the same conclusion, and that is that it's time for mind-body practices to do what they can do, which is to radically change everything on the planet, not just socially and personally and mentally and emotionally, but economically, and transform our healthcare system. Sharon was alluding earlier to some of the issues that Robert Kennedy Jr. brought up about diet and the pharmaceutical-driven issue of our healthcare system. And I was going to mention one thing to Ankol is that in the United States, less than 0.5% of NIH funding goes to complementary and alternative medicine research, because it's all pharmaceutical money, and so it goes to pharmaceutical research. And so that's why going the route of getting this through a United Nations resolution into public education could be so catalytic to make things happen very, very quickly. And, some of my American counterparts, they say, well, Bill, you're not going to be able to do that because pharmaceutical companies really pretty much have a death grip on the United States. But the thing is I don't care. I don't care about the United States doing this. Because we know that the United Nations General Assembly voted in International Day of Yoga with a record number of co-sponsoring nations. So the world is ready for this. And if we can get the United Nations General Assembly, which voted in the International Day of Yoga with a record number of co-sponsors, to do the same thing with this, then all those American and UK Tai Chi teachers or mind-body or teachers, public education teachers, they would be able to take that proclamation into their school board and into their administration meetings and say, look at this science, look at what it'll do for our students. And so for me as an American citizen, it's an opportunity for me to have an effect on a planetary scale that I could never have in my own country right now with the current political and health system that we have. So,
Sharon, before we take your comment,
yes.
Amrita, let's take a quick comment from Lata, and then we go back to Sharon. Lata, you had a comment to make, so go ahead.
Yeah, global namaste, everyone, and another fine episode. Congratulations, everyone. So what I'd like to just bring in the thought of the reason why we've got so much disease and unrest and unease mentally, physically, emotionally, every form, is because we're not. Is it because we're not in connection with our chi, our energy, and we're out of alignment with that? And it's such a profound truth that we as a nucleus are discussing it here, that this is a vital key and a link to really solving mankind's problems on this earth. And that's why we were, to be in touch with nature and energy and the chi, and to discover the valuable benefits of it and how it can relieve so much confusion in the world, really. So, we need to work towards that goal. I think it would be lovely to maybe, explain that to them, how we are in this position, why we're in this position, because we're being obstinate, maybe, and rejecting it, whether it's control, whether it's ego, it's all the things that have a partial role to play in it. So it would be, very, what's the word? Liberating to actually overcome that thought, and when mankind actually connects. And it doesn't matter if everyone doesn't connect, like Neil says, who cares? We've just got to keep doing our task and our role in this vital mission in life. So
Thank you,
all
Lata. Thank you.
It becomes increasingly apparent that there are vast economic interests in keeping the sick care system that we have. So we know that, but what I've come to terms with is that what is required of us as a mind-body community is to just find our esteem. And the way that I found my esteem was just immersing myself in all this science. Because the more I swam in the science, the more my soul started to scream out, this is crazy. This is crazy, this health system that we have, and this education system that we have, and this prison system that we have, and that it could all change. So the only thing that we can do really as mind-body practitioners is just to really come to terms with this. I encourage everybody to learn all the science, and we have it all at globaltransformationproject.org. You can immerse yourself in it. And then it's like we find our esteem, and we just start, like somebody on one of our programs said, what I love about you guys is you're screaming this stuff from the rooftops of the world. And so that's what we have the power to do as mind-body people, is to find our esteem, and because we all know this stuff is transformative. We've all experienced it. And so now to find our esteem and just keep saying these things from the rooftops of the world with being undaunted, because we know that that these things are real, and that we're in an important place at this moment in history to do it, to say these things wherever we can.
Thank you, Bill. Let's go to Anukul. Anukul, your comment.
I had a small comment, interesting comment, because this is regarding this is what William Douglas was talking about, and that is I did my fellowship in spinal surgery and hip reconstruction surgery in Los Angeles many years ago. I'm talking of, I think, way back in 1990s, and I'd also worked with the Rand Corporation to see how the people changed from one system of care to the other system of care, like chiropractic treatment to osteopathic treatment and physiotherapy. Now, in our conventional spinal surgery, we normally send them for normal physiotherapy. Now, we as surgeons just do a bit of surgical work, and after that, it's a question of sending them to some physical therapist. But it's very interesting to see that when it comes to sending and giving an opinion to somebody as to what would be the appropriate way of managing it, they said we have already had enough of physiotherapy, is nothing working. Then I said, all right, in the NHS, you have to send them to go to an osteopath, a chiropractor, as it is normally not, the funding is not granted for something like that. So it's a question of how to get them the right kind of funding. And I've at times been challenged, not challenged exactly, but question, is it necessary that when I give my medical legal reports for the courts, they often ask, particularly when it happens to the clinicians or some doctors who come to the treatment, and I give a medical legal report, then I say, all right, you try to go and give it a trial with, say, Tai Chi or chiropractic treatment, osteopathy. They'll say, we don't know whether that will be the right thing to do. I said, don't worry, it's just a physical therapy, and that's all about it. You take it as a physical therapy rather than take it as something. But there's still questions asked, so we have to keep on providing evidences every time. So I think that's one of the things that we want to make sure, that a comprehensive care can be given to the people at various levels, number one. Number two, that I find always very challenging is that Usually I take quite some time because lots of patients have had 2, 3 surgeries and they're not any better. They've got various additional operations and lots of pain. So patient is shunted between pain management clinic and our clinics. And when I go back and looking into the things, then you'll be surprised how often socio-psychological factors, mind factors, child abuse factors, and so many other things come into play. Then you start realizing that these things are never addressed by any possible means, and they will never be treated correctly because they will keep on going from clinic to clinic, clinic to clinic, and it costs a lot. It's only when I say that, well, fine enough, I'm not a psychologist. I'm going to tell you that these are the factors. You try to look into it yourself and see what best way you can manage it. But that's where all your sort of assistance will come into the play because it is you can just see the mountain of heap of problems around, but you don't have the answers and you don't have the competence to manage it either. So I think that will be a very, very educational thing from all of you that I'm learning so much. And I am very much into Vedanta. I mean, that's what I've been doing for the last 20 years. And yet I'm in the pre-primary class, as I said. And that's where I sort of stand even now. So I do a lot of studying and all this kind of things, but all these things require a guru. So it's not something that can be done by reading. So it's quite a bit of interesting stuff over here. Thank you. That's it.
Thank you, Anukul. Amrita and Vaishali will be in touch with you, as will Sharon.
Yes.
You in touch as
Yes.
well. Mita, your quick comment, and then we close with Amrita and Sharon.
Yeah, global namaste, and thank you everyone for wonderful insight into this, one of my favorite subjects, integrated health. When it started at Healing Your Earth, I remember when we started the first episode. And we had some input from doctoral students from University of Surrey on sleep therapy or sleep research. Yeah, I totally agree with Will that it has to start young. And Neil, you were also saying in the previous episodes that if we reach out to the school to make this well-being related, aspects, Ayurveda and other things, Qigong, imbibed into children's education. That's how I grew up when I was in India, and I was in school, in secondary school, year 7. I did 1 year's yoga. It was compulsory, and we had to do it. So it goes into your system. That stayed with me together because when Ramdevji wanted to come to Guildford in 2008, he wanted to only meet the staff of NHS and researchers at the Mountain Research, Cancer Research Center. So yeah, there are efforts made by people all over, and it's interesting, how many of us are getting together to make this happen on this platform, and the reach through this platform is going to be enormous as well. And I think we have achieved a lot since the first episode, I remember. And thank you very much, Sharon, for your films. They're fantastic. Me being a television producer in my previous life, I could feel as someone was saying in the comments that the movement and Qigong is that breath, movement, and intention. So I made me remind my times when I did Tai Chi in Himalayas many, many years ago. So there's so many similarities. I learned that for the first time at that time. So yeah, thank you. This program should be, still far reach to the right people who can listen to this, because as Dr. Ankur was saying, it's NHS is struggling, is trying to find solutions, because I was teaching at one of the courses on mental health, spiritual health, and pastoral care at NHS. And yes, they want to know more about these alternative therapies so that, they can incorporate, and their responsibility gets a little bit shifted to the community as well. And at the same time, the treatment is done with less cost possibly to the NHS. Yeah. Thank you very much, Neil, for this. Thank you.
Thank you, Amrita. Sharon, over to you. Let's close now, and thank you to everybody. So over to Amrita and Sharon.
I've been asked to speak by our dear Amalia Waiching about, she's going to be teaching at this Body, Mind, and Soul Mallorca Live More Consciously and Healthy event. That's from the 17th to 20th of October. Experience a transformative journey to a more conscious and healthy life at the beautiful Sun Club El Dorado Resort in Cabo Regana, Mallorca. And let me see if there's, yeah, their website is Body, Mind, and Soul Mallorca.com. And anyone that goes, I'm sure, experiencing Amalia's teaching is really wonderful. She's an amazing healer and Qigong teacher. So she asked me to speak about that. And it's been wonderful to be with you. You know, in doing my movie, I wanted the first trailer you saw was more yin, and the second was more yang. So now I have a new part in the middle that's a beautiful meditation. So you can really experience it. And I'm grateful to be on the show. It's wonderful to be with all of you. And let's do everything that we can to bring true health to our children, to everybody in the world, and to our planet. It's so important. I've been really inspired by the words of Bobby Kennedy and Nicole Shanahan. Their hearts are so involved in, and their knowledge, their depth of knowledge about the issues we're facing is profound. So I encourage anyone to watch them, whatever you've been told. They're just very clear. They're like all of us. That's what I felt when I watched. I said, oh, they're like everyone on Healing Earth. But it's a serious issue. And if we want our Earth and ourselves and our humanity to continue, we really need to address these issues that we are addressing here and bring them out to as large an audience as we can.
Yeah, absolutely true, Sharon, because the olden times were the time, the ancient time mostly was the time which was more integrated with an outside world, where people had disorders in relation to natural disasters or something like an accident or something like, we were not aware about. But internally, we were quite at peace. And now is the time where the inner peace has gone. And a lot of energy is required to think on spiritual healing, because the internal healing and working towards contemplation, whether it is through any means of Tai Chi, Qigong, a practice of Ayurveda, practice of ancient knowledge systems, herbal healing, or shaman therapies, or anything, will definitely open up the doors for meeting up the today's need of today, where people need to work on spiritual healing, which is the internal healing, where people can find peace within them. And that then only we can address all the problems that are related with the mental health in connection to physical health. And that's where the platform is. And that's why today we are at the verge where we need to find out the evidence of what Qi is, where is it working. But we cannot deny the fact of this existence, because it is ever since the ages, the earth was there and will stay beyond when we all will still die. And therefore, with that note as a question mark in all the minds of our viewers, just think about who we are, how we have come, and how blessed we are to be blessed with this Chi, this prana, this life force, which is within us, around us, and sustaining the whole universe, that we say we are alive. With this note, let's have a Gayatri mantra and close to this session. Thank you. Om Bhurbhuvasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Om Bhurbhuvasvaha तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्। ॐ भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्। ॐ